What's up, world? Hey, what's up? What's up? What's up? You guys already know the deal. You guys already know the deal. We are doing NCLEX questions. You want to know why? Because learning never stops at all. Learning never stops ever. So appreciate everybody that's jumping in. You guys already know the deal. We're going to be doing NCLEX questions today. Hopefully everybody had a last good couple of days since on Monday. Monday was a good day. If you guys have noticed, I'm kind of froed out right now because, I'm just kind of froed out right now. Just kind of chilling out. Karam, what's the deal? What's up? Welcome. I see Kate just jumped up in here too. What's up, Kate? Hey. You already know the deal. Hey, I need 100 people up in here. We need 100 people, and I need for y'all to smash that like button. Hey, smash the like button. Give me 1,000 likes right now because y'all be holding out. Y'all be holding out. You know what I'm saying? Y'all come over here and y'all be trying to get this work, but y'all don't want to give me no work. You know what I'm saying? So, hey, 1,000 likes. I need 100 people over here. Make it happen. I want to know who you are, where you're from, where you're at in your nursing journey. I need to start working. Karam, hey, get out there and start working. You know the deal. You already know what you got to do. But, hey, I want to know who you are, where you're from, where you are at in your nursing journey. All right. Hey, a little bit about me. Been a nurse for 3.5 years. Worked in ICUs, worked in OR, worked in PACU. Been in the Navy for 16 years, right? Been in the Navy for 16 years, you know what I'm saying? So shout out to all my folks that are out there from Trinidad. Okay, LPN for 3 years, getting ready to promote. Okay, shout out to you, Miss Brittany. All right. It says NVA, just passed my first semester of RN program. Shout out to you, is it Shamika? Shout out to you, Miss Ma'am. All right. Hey, so you already know the deal. Hey, I'm almost to 1,000 likes. I know y'all got to get carpal tunnel for me. Carpal tunnel, you know what I'm saying? Hey, we almost to 100 folks. Once we get it turned around, once I get 100 people up in here, y'all already know the deal. Oh, now you're back. What you mean? I've been here, Belle. I'm always here, on time, every time. Where you been? Don't come over here playing with me like that. Don't do that. Don't you do that. Hey, Kate, I know that she was over on your live. She was like, oh my God, are you the one that was over there? And I'm just like, yeah, that was me. She's just like, oh my God, I'm going to be your friend now. I'm like, whatever, bro, do you. Andre said, just took first attempt on the NCLEX. Shout out, is it Andre? Shout out to you, Andre. Hey, I know that you rocked that exam. All right. Hey, like, share, and follow. It's not just about the likes, y'all. Y'all got to share and y'all got to follow. You know what I'm saying? Putting words in my mouth. Ma'am, I did no such thing at all. So, hey, we're hanging out. Let's see what's going on. It's like, no, it's something you said. Oh, okay. I commented on your live in August, fighting for my life and physio. Kayla, you was fighting for your life. You be killing me with that. Hey, that's what I'm talking about. Shout out to you, Miss Ma'am, for getting a 92. I love Patho. Patho was one of my favorite classes. So it says, Kyla says, I am a second of 5 and I passed with 4 A's and a 1B. Shout out to you. All right. Hey, I need for y'all to share. Ain't nobody shared it. Y'all just up in here. Hey, if y'all are in school right now, I don't know why you haven't shared it with your cohort. I don't care how you feel about them. You don't have to like them, but let them like me. Okay. Let them like me. All right. Let them like me right now. All right. So, you know what? I'm just going to turn it around anyway, because, your boy's on a schedule. We got stuff we got to do around here. So here we go. As a matter of fact, let me go back one. Hey, y'all, we are doing NCLEX questions. I got them off nurseslabs.com. Make sure you feel attacked, ma'am. It has not even began. I'm just kidding. Hey, we got these questions off nurseslabs.com. So free sets of questions. You guys can go over there and check those out for yourself. But always make sure you guys are smashing that like button. Make sure you guys share. Make sure you guys follow. Hey, we're on the road to 10,000 likes. Don't be greedy. Get carpal tunnel from me. Stop playing games. Here we go. Question number 1. The nurse should visit which of the following clients first? So this sounds like a management of care type of question for me, right? Is it a client with diabetes with a blood glucose of 95? Client with hypertension who being maintained on lisinopril? Is it a client with chest pain with a history of angina, or is it a client with Raynaud's disease? What are we thinking? Shout out to everybody for joining. We are doing NCLEX questions. So make sure you guys go over there and check those out. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, did anybody graduate this past week? Shout out to all my folks that graduated. As a matter of fact, let me put you guys on a timer because y'all take too long. Chest pain. Okay, we got C. Everybody's telling me C. Okay, shout out to y'all. Give y'all 5 more seconds in 4, 3. Yeah, Camille, you graduated. That's what I'm talking about. Shout out to everybody that graduated. Hey, so the answer is, of course, it is C. The client with chest pain should be seen first because this could indicate an myocardial infarction. Despite many advances in treatment, acute MIs still carry a mortality rate of 5 to 30%. The majority of deaths occur prior to arrival to the hospital. In addition, within 5 years after an MI, there is an additional mortality rate of 5 to 12%. The overall prognosis depends on the extent of the heart muscle damage and ejection fraction. That is part of management of care, which is the largest section on the NCLEX. Wow, nursing is so easy. Sure, Bell. Sure it is. Management of care. Largest section on the NCLEX at 18 to 23%. It says Kevin's going to boot you. Hey, Kate, you better let her know not to come up here and play with me because you better let her know about that 600. You better let her know. I don't be playing with them. Hey, we got question numero dos. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication when? So when do I want to give this medication for somebody with cystic fibrosis? Is it A, once per day in the morning? What's a 600? I'm going to need for y'all to let her know what a 600 is. Is it once per day in the morning, 3 times per day with meals, once per day at bedtime, or 4 times per day? All right, everybody screaming B. Ashlyn says B. We got B. Okay. All right, well, I got a couple of seconds, so I'm going to tell you. A 600, all that means is it's 600 seconds, which equals 10 minutes, and that's how long I'm going to ban that ass if you come over here playing with me, Bell, okay? I'm not going to ban you, but if you act up, I will ban you. I promise you. You better ask somebody. Typo, it's all good. It's all good. My man, I see you in there. It says, hi, I graduated 12/16, taking my NCLEX in January. Shout out to you, sir. Is it Senor? Shout out to you. Congratulations to everybody that graduated these past weeks. All right, Christmas is coming up. Me, act up, never, girl. All right, here we go. Here's our answer. And the answer is B, 3 times per day with meals. Pancreatic enzymes should be given with meals for optimal effect. These enzymes assist the body in digesting needed nutrients. Chronic supportive therapy for clients with cystic fibrosis include regular pancreatic enzymes, fat-soluble vitamins such as A, D, E, and K. This is the mucolytics, bronchodilators, antibiotics, and anti-inflammatory agents. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. Or there's another one I saw where it's 13 to 19%. But regardless, still the second largest section, still a lot of information. You got to know it. Y'all got to know it. All right. Here we go. Question number 3. Cataracts results in, opacity, whatever, of the crystallized lens. Which of the following best explains the functions of the lens? The lens controls stimulation of the retina. The lens orchestrates eye movement. It focuses light rays on the retina, or it magnifies small objects. Hey, if you guys are just joining, welcome. Got these questions off nurseslabs.com. Free sets of questions. Also, if you're in nursing school, they're really great with, they have, nursing care plans. Yeah, nursing care plans that are over there, so you guys can go over there and check that out as well. It says this, taking step 1 in 6 months. This is a great review. Thanks, Rich. My pleasure. I enjoy doing this, all right? Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, make sure y'all like, share, and follow. I need 10,000 likes, and I need for y'all to smash that. I need for y'all to share, and I need for y'all to follow me. Be cool with me. Be my friend. Be my friend. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. Considering nursing school, hey, well, this is a good spot to start. And the answer is C. The lens focuses light rays on the retina. The lens allows light to pass through the pupil and focus light on the retina. The lens is a curved structure in the eye that bends light and focuses it from the retina to help you see images clearly. All right. So physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right. Hey, the big 3: management of care, pharmacological and parenteral therapies, and physiological adaptation. Those 3 sections alone make up 44 to 49% of the entire NCLEX exam. All right. So shout out to y'all, everybody that's getting that answers right. So you already know what we're doing. On to question number 4. How long is nursing school if you have prereqs done? Depends on the nursing school that you go to. The client who has glaucoma is to have myotic eye drops instilled in both eyes. The nurse knows that the purpose of this medication is to what? Anesthetize the cornea, dilate the pupils, constrict the pupils, or paralyze the muscles of accommodation. What do we think? It says, does the NCLEX allow you to be a nurse like nationally? Yes, it does. It's a national exam that allows for you to practice nursing here in the United States and in Canada. So shout out to y'all. What are we thinking? What are we thinking? Hey, little fun fact about me, y'all. I failed the NCLEX 3 times. 3. 1, 2, 3. All right. And let me tell you something right now. No job, nobody anywhere is ever going to care about how you failed it or if you failed it. No one's going to care. All right. Get out of your own way. Get out of your own way. All right. What's up, Alyssa? All right. It says, do they have state tests too? No, they don't. It's only the NCLEX is a national exam. All right. I just failed 3 times on 21. I don't know what that means. Oh, on the 21st. I got you. How do you pay for retake? You go through your board of nursing. All right. Here we go. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. And our answer is C. It constricts the pupils. The miotic eye drops constrict the pupil and allow aqueous humor to drain out of the canal of sclellum. Don't even know. I swear I'm just like, bro, I don't remember these from nursing school. But yeah, so that's what it does. Pharmacological parenteral therapy, second largest section on the NCLEX exam at what? At what? 14 to 18%, or depending on whatever else you're looking at, it's 13 to 19%. But regardless, it's still the second largest section on the NCLEX. Okay, I'm sending a strong word into the Department of Health. Hey, good luck. Good luck on that. It says once you pass, you're a nurse. Keep studying. Don't give up. Facts. All right, here we go. Question number 5. A client with a severe corneal ulcer has an order for gentamicin, drops Q 4 hours, and neomycin 1 drop Q 4 hours. Which of the following schedules should be used when administering the drops? Is it A, allow 5 minutes between 2 medications? Is it B, the medication may be used together? C, the medication should be separate by a, what is it, the cycloplegic drug? Cycloplegic. The medication should not be used at the same time with the client. What are we thinking? Hey, by the way, if I have a bunch of people that will come in here and tell me that I don't know how to spell words or say words. That's okay. You could just call me the Floyd Mayweather of understanding medical terminologies. All right. What are we thinking? What are we thinking, y'all? Hey, shout out to everybody that just now joined. We're doing NCLEX questions. I got them off nurseslabs.com. Nurseslabs.com, free sets of questions. You guys can go over there and check those out. I do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time because that's the only time that matters, especially if you're in Texas, you know, even though the Cowboys lost because they're dumb. So what do we think the answer is? Yep. Is it corn dog? Not even reading that. So here we go. Here's our answer in 3, 2. And the answer is A. Allow 5 minutes between the 2 medications. Hey, so we're talking about medication, so it's still pharmacological and parenteral therapies, right? So second largest section on the NCLEX exam. When using eye drops, allow 5 minutes between each or between the 2 medication. Antibiotic drops are prescribed by the doctor to treat bacterial eye infections. They work by killing the bacteria that enters the eye and causes the infection. All right. So sometimes it's that easy, but sometimes it's not because you have no idea where people are at in their nursing journey. So I really need people that come into the chat. I really need for y'all to understand that because y'all be forgetting where the fuck y'all be coming from. You know what I'm saying? Y'all be forgetting. No, you're good. Corn dog. I'm just messing with you. You're good. Hey, so I have a free download over there, y'all. Check out thebootnurse.com/test, or you guys can go to the link in my bio and you guys can check that out as well. Free tips, tips on how to conquer the NCLEX. You know what I'm saying? It's 42-page little PDF. Once you guys have it forever, talk about little keywords, management of care stuff, delegation, all that good jazz. That's over there. So you guys can go over there and check that out for yourself. Hey, we're still on the road to 10,000 likes. Hey, get carpal tunnel for me right now. Question number 6. The client with color blindness will most likely have problems distinguishing which of the following colors. Is it orange, violet, red, or white? White. I'm going to say that in my Calvin Candy voice. White. What are we thinking? Hey, if you guys are new here also, I want to know who you are, where you're from, where you're at in your nursing journey. All right. And if you're not a nurse, what you doing hanging out here with us? You're trying to be like Belle and you're trying to troll or what? New Generation NCLEX, please. Hey, I just want to let y'all know I did New Generation NCLEX questions on Friday and nobody showed up. I did case studies and everything. And also what I would like to tell you is that the New Generation NCLEX, all that means is just there's different types of questions that is delivered to you. Management of care, but multiple choice, still there. Select all apply, still there. The only thing that's added there is like the case studies where they give you all the info. So I'll probably do them on Friday, but if I don't do them on Friday, sorry. But I'll be doing them. I need max attendance for that because some folks are just like, oh my God, what kind of nurse am I? I work in the OR now. Here we go, y'all. Here's our answer in 3, 2, no, on my way to be a nurse. Oh, okay. Shout out to you. Please do them. I did do them. But hey, these are already a set of questions. So this is what we're working with today. And the answer is B. It is violet. Clients with color blindness will most likely have problems distinguishing violet, blue, and green. The most common form of, what is it? Oh my God. It's pronopia and duratopia. Conditions arising from loss of function of one of the cones, leading to dichromic vision. Physiological adaptation, y'all. Third largest section on the NCLEX. You said physiological adaptation on the NCLEX. All right, I'm so mad that you picked B and you got it right. That's okay. That's the thing. Usually your very first answer is the correct answer. All right, so never go back and change. And also, you'll hear me say RTFQ. RTFQ. Who can tell me what RTF and Q means? Just got to sit my NCLEX and just landed a job. Shout out to you. Is it Kristen? Shout out to you for landing that job in the ER. Go out there and take care of that controlled chaos or just absolute chaos. Here we go. Question number 7. A client with a pacemaker should be taught to what? Report ankle swelling, check his blood pressure daily, refrain from using a microwave oven, or monitor his pulse rate. What are we thinking? What are we thinking? Hey, make sure you guys keep smashing that like button. Hey, I need 10,000 likes. 10,000 likes or I'm boycotting when I get to question number 10. Yeah, I said it. Hey, also, I want to let you guys know that I got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. All right, you guys can go over there and check those out for yourself. All right, this is a comprehensive little exam that I found on there that I think would be pretty helpful for everybody. So make sure you guys go over there and check that out. I'm at work, computer. I don't know. Okay, I got you, Belle. I got you. He's like, this is hard. Hey, so that's what I'm saying. It all just depends on where you are in your nursing journey on if you are going to get these answers right or not. But this is the whole point on why we practice. You need content, questions, and Q&A and rationales. And the answer is D, monitor his pulse rate. The client with a pacemaker should be taught to count and record his pulse rate. Pacemakers are adjustable artificial electrical pulse generators, frequently emitting a pulse with a duration between 0.5 and 25 microseconds with an output of 0.1 to 15 volts at a frequency of up to 300 times per minute. The cardiologist or pacemaker technologist, I'm about to say technician, but technologist will be able to interrogate and control the pacing rate, the pulse width, and the voltage, whether the device is temporary or permanent. That is part of health promotions and maintenance. Lower section on the NCLEX, 9 to 15%, but still very much important. Still very much important, okay? So this is what I'm trying to tell you guys. When you guys are studying, you need content, you need Q&A, you need rationales. Rationales, just like the one that we just went through, help solidify what you are learning, all right? What you are learning. All right, here we go. Question number 8. A client with, oh my God, enuresis. Oh my God. Enuresis is being taught regarding bladder retaining. Jeez Louise. The nurse should advise the client to refrain from drinking after what? 1700, 1200, 1000, or 0700. What are we thinking? Thank you, queens. I'm not a queen, but cool. But shout out to everybody. What did I miss? What did I miss? Somebody pass. Congratulations to all my new grads. Hey, shout out to you, Miss Steph. What happened? Bradycardia. I just graduated. Okay. Oh, you graduated. Okay, I got you. I'm tracking. I'm gonna give y'all 10 more seconds. I don't even know what year. That's okay. We finna find out. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is A. It is 1900. Clients who are being retained for bladder control should be taught to withhold fluids after about 7 p.m. or 1900. If you go to the toilet too frequently, just in case, you might end up making the overactive bladder symptoms worse, because the bladder is often then trained to send a signal that you need to urinate as soon as there is only a small amount of urine in the bladder. So that's also health promotions and maintenance, 9 to 15% on the NCLEX. And as well, yes, it does involve also sleep. What did you say? Sleep. It disrupts your sleep, right? It 100% disrupts your sleep. Just like, hey, would I give somebody some furosemide at night? Like, why would I do that? They're going to, unless they have a catheter, you know what I mean? 1900 to 7 p.m. in military time. Correct. Also nursing, they use military time. So if you guys are not used to using military time, get used to it, because they talk about it. They talk about it in school as well as they talk about it on NCLEX as well. Question number 9, which of the following diet instructions should be given to a client with recurring urinary tract infections? Is it intake, increase the intakes of meats, avoid citrus fruits, perform pericare with hydrogen peroxide, or drink a glass of cranberry juice every day? What are we thinking? Shout out to all 400 of y'all that are in here rocking with me. We're doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. That's the trifecta that TikTok needs, so we can get it out to people. Also, if you're still in school, or if you don't graduate for like another year, 6 months or whatever, I don't know what you're doing by not sharing this with somebody. I don't care how you feel about people in your cohort. Just share it to them. Because I know you in a group chat. You know what I'm saying? I know y'all in there. Group me. You know what I'm saying? Or whatever the other ones are. All right, y'all. Here we go. Here is our answer. In 3, 2. And the answer is D. Drink a glass of cranberry juice every day. Oh, look at that. Cranberry juice is more alkaline, and when metabolized by the body, is excreted with acidic urine. Bacteria do not grow freely in acidic urine. Look at that. Part of health promotions and maintenance, 9 to 15% on the NCLEX exam. Shout out to everybody that got that question right. So shout out to all of y'all. We are going to move on to the next question. All right, here we go. Question number 10. The physician has prescribed NPH insulin for a client with diabetes mellitus, diabetes. Which statement indicates that the client knows when the peak action of the insulin occurs? I will make sure I eat breakfast within 2 hours of taking my insulin. I will need to carry candy or some form of sugar with me at all times. I will eat a snack around 3 o'clock each afternoon, or I can save my dessert from supper for a bedtime snack. What are we thinking? Shout out to all y'all that are in here rocking with me. Hey, if you are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing in here? Besides Bell, we don't care what you're doing, because you said you're sitting at a computer. We don't care about what you're doing. All right. Another little thing about me, I've been in the Navy, the U.S. Navy, for 16 years. Was a surgical tech for quite some time. I've been an instructor and educator it'll be 9 years. It'll be 9 years next month. I used to be a ACLS instructor. I used to be a pre-hospital trauma instructor, taught advanced burns, as well as I'm a trauma nurse instructor now. So I've been teaching for quite some time, and a lot of people ask me, why am I not in academia? It's because of my filthy mouth. All right, no, I'm just playing. But it's just because I can't do it. It's going to make me cry again today. Oops. Hey, I'm sorry. Maybe. Here we go. Here's our answer in 3, 2. And the answer is C. I will eat a snack around 3 o'clock each afternoon. All right. So the NPH insulin peaks at 8 to 12 hours. So a snack should be offered at that time. It is on the list of essential medicines of the World Health Organization. Insulin is FDA approved in the adult and pediatric population for the control of type 1 and type 2 diabetes. That is part of health promotions and maintenance. Sorry, guys, if that is so small. All right. That's just the only way that I can make it work. All right. Health promotions and maintenance, 9 to 15% on the NCLEX exam. So shout out to everybody who got that question right. All right. Hey, well, another thing, y'all. Hey, I have an ebook, I created an ebook talking about the NCLEX, all the important things that you need to know, right? Also, there's some other things that are just even a little bit more. So I'll give you a little bit more. I'll give you an abundance of stuff. So you guys can go over there and use it to your leisure. It's over there at thebootnurse.com/victory, or you guys can go to the link right there in my bio, and that'll take you there as well. You guys can go over there and you guys can check that out. Okay, here we go. Question number 11. The nurse is caring for a 30-year-old male admitted with a stab wound. Now paint the picture. Somebody just got, like somewhere, right? In the emergency room, a chest tube is inserted. Which of the following explains the primary rationale for insertion of Chest tubes, right? The chest tube or the tubes will allow for equalization of the lung expansion. Chest tube serves as a method of draining blood and serous fluid and assist in reinflating the lungs. Chest tubes relieve pain associated with a collapsed lung, or chest tubes assist the cardiac function by stabilizing lung expansion. What are we thinking? You're going to say B? Cool. Everybody's saying B. Shout out to everybody in here. Shout out to all 500 y'all in here rocking with me. Is it Desi, or Daisy? Daisy. That's just different on how people spell their name. So shout out to all y'all that are in here rocking with me. All right. Hey, make sure y'all smash that like button. Make sure you guys share. Make sure you guys follow. Steph says B. All right. Happy Moo. Your name. It's Moo. Okay. She says B as well. Got you. I'm tracking. All right, y'all. Darla, shout out for you for following. How long do people need what? How long do people study for NCLEX for? It depends. Some people study 30 days. I've coached people for 2 weeks and they've taken their NCLEX. But there's a lot of things that go into that. So happy Moo. All right, and let me stop. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is B. Chest tubes serve as a method of draining blood and serous fluid and assist in reinflating the lungs. Chest tubes works to reinflate the lungs and drain serous fluid. Physicians use a chest tube to create negative pressure in the chest cavity and allow re-expansion of the lung. It helps remove air, blood, fluid. Is it a chyle or empyema? Okay, empyema. I was about to say emphysema. No, but it's empyema from the intrathoracic space that is part of pharmacological and parenteral therapies. Right? Pharmacological and parenteral therapies, second largest section on the NCLEX exam. I failed 3 times. Hey, Mrs. Frazier, me too. I failed 3 times and I passed on the 4th. That's what I'm talking about. We out here making it work. Is this for RNs or LPNs? It's for both. All right. So shout out to y'all. Hey, I failed the NCLEX 3 times, y'all. No job is never going to care. Get out your own way. Get out of your own head. Put in the work. Look at your breakdown. See what you didn't do and then improve upon it. All right. Improve upon it. All right. I don't want to hear nobody. Oh my God, I failed my test. And so did I. What you doing? What you going to do? What you going to do to fix it? All right. Don't come over here complaining. You better complain, but you better come with a solution. You see what I'm saying? You got to keep pushing always. Here we go. Question number 12. A client who delivered this morning tells the nurse that she plans to breastfeed her baby. The nurse is aware that successful breastfeeding is most dependent on what? Mother's educational level, infant's birth weight, size of mother's breasts, or mother's desire to breastfeed. Yes, Drill Sergeant Kevin. First of all, I am not. I couldn't be a drill sergeant if I want to because I'm not. I wasn't in the Army, so I'm in the Navy. We have what we call RDCs, and it's a good thing I didn't go there because I probably would have put hands on somebody because I'm crazy. I'm just playing. Shout out to y'all. You already know the deal. I'm going to give y'all 15 seconds. It's either A or D. Hey, you got to give me one. Give me A. A good decision now is better than a great decision later. Trust and believe me when I tell you that. All right. And remember, this is just practice. This is why it's important. It says, I knew you were in the military, but what? I knew you were in the military, but Mr. Tracking. Hey, first of all, Bell. Hey, don't. Bell. Bell's pushing it. He ain't playing. I ain't playing with y'all. Y'all better stop playing with me. All right, here we go, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is D, mother's desire to breastfeed. Success with breastfeeding depends on many factors, but the most dependable reason for success is desire and willingness to continue breastfeeding until the infant and mother have time to adapt. Breastfeeding is an important part of a newborn's life. Breastfeeding or lactation provides total nutritional and emotional dependence of the baby on the mother. The strong emotional bond between the mother-child dyad is needed for successful prolonged breastfeeding. That is part of health promotions and maintenance. Hey, I don't know if you guys knew this, but did you know that if you work in labor and delivery or anywhere, if you want to go and be a lactation nurse where you specialize in just helping moms and babies, breastfeed, you can do that. I'm just saying. Hey, the more that you know. All right. The more that you know, y'all keep coming here and y'all keep messing with me. Y'all gonna get all this knowledge. You know what I'm saying? Question 13. The nurse is monitoring the progress of a client in labor. Which finding should be reported to the physician immediately? So what is happening? Like, oh my God, help, right? Oh my God, help, right? So the presence of scant bloody discharge, frequent urination, the presence of green tinge amniotic fluid, or moderate uterine contractions. What are we thinking? Belle, are you in here making people mad? Belle, come on, Belle. Don't be out here making folks mad. Hey, if you guys are new here, welcome. You guys are just now joining. We are doing NCLEX questions. These are both for RNs and LPNs. I got them off of nurseslabs.com. Nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. Also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what you doing here rocking. All right. And by the way, hey, I'm all about having fun down in the chat and, fostering a good environment, but don't come into my chat trolling, because if you troll me, I promise you, I'm going to ban that ass. And I mean it. I mean it. I will stop. I will cease everything and I will ban you. I promise you. I just got pinned. That's what I'm talking about. All right. So from the UK, shout out to you, Jenny. I didn't get to read it because it's gone. So I'm Shayna, midwife in Jamaica. Okay. All right. All right. Shout out to you. Is it Minding K? Miss Ma'am, thank you for the roses. Appreciate you. New LPN. Okay. All right, y'all, here we go. Here's our answer. On the road to 20,000 likes, y'all. In 3, 2, and the answer is C, the presence of green tinge amniotic fluid. Green tinge amniotic fluid is indicative of meconium staining. This finding indicates fetal distress. Amniotic fluid should be clear or straw tinged with small vernic particles in the fluid. Brown or green staining of the fluid indicates the passage of meconium. Because the fetus swallows amniotic fluid in utero, meconium can be present in the infant's oropharynx at delivery, right? So that is part of health promotion and maintenance. That's down here if you guys can see that. Health promotions and maintenance, 9 to 15% on the NCLEX exam, okay? Hey, top 3, farm, physiological adaptation, management of care, to make up 44 to 49% of the entire NCLEX. So this is how, when you guys go through it, this is how, when you retain it, this is what you got to know. And if you don't know what words mean, this is where you had to do that extra step of research for yourself. So if you don't know what a word means, ain't nothing that Google or a book can't show you. All right. And I ain't saying that in a rude way. I'm just keeping it a stack. I think that's what the kids say. But anyways, so here we go. Question number 14. The nurse is measuring the duration of the client's contractions. Which statement is true regarding the measurement of the duration of contractions? The duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. Is it the end of one contraction to the beginning of the next contraction? Is it from the beginning of one contraction to the end of the same contraction? Or is it from the peak of one contraction to the end of the same contraction? What are we thinking? Hey, so in case nobody knew, this is from the labor and delivery or the maternity section, mother, baby. One of the things you really got to pay attention to are the labor stages and the labor phases. They are two different things. They are two different things. So you have to pay attention to the stages and the phases, okay? Stages and phases. Hold on, y'all. Hey, by the way, if you guys start seeing stuff that comes in here, and they're like private ones where it's saying like, oh my God, buy my OnlyFans pics. First of all, we don't buy OnlyFans pics around here. It ain't nothing that the internet can't give me for free. All right. And our answer is C. Duration is measured by timing from the beginning of one contraction to the end of the same contraction. All right. Duration is measured from the beginning of one contraction to the end of the same contraction. Duration is timed when you first feel a contraction until it is over. This time is usually measured in seconds. All right. That is part of physiological adaptation. It says never OB, ICU, ER. Hey, look, I work ICU, I worked OR, and I've worked PACU. I don't know nothing about labor and delivery is where I stay far away from. Far away. All right. So shout out to everybody that got that question right. All right. Shout out to everybody that got that question right. On to the next one. All right. Question number 15. The physician has ordered an intravenous infusion of Pitocin for the induction of labor. When caring for the obstetric client receiving intravenous Pitocin, the nurse should monitor for what? Is it maternal hypoglycemia, fetal bradycardia, maternal hyperreflexia, or is it fetal movement? What are we thinking? That is a trick question. Duration, pay attention. Yeah. Hey, RTFQ, when you read the question, look for those key words, but then also you apply what you know versus trying to apply what you don't know. And if you truly don't know, then that's where you guess, right? So always think about ADPI, right? Do we assess? Do we implement? Is there enough information in there to where I can just jump in? Or do I need to further assess to where I need more information, right? And there are some things that you just have to know. All right. You just have to know them. All right, y'all. 10 seconds. 10 seconds. Hey, on the road to 20,000 likes. I don't know what happened to y'all's fingers, but y'all getting a little, you know what I'm saying? Y'all got to make some stuff happen over there. It says, I always go with your first answer you thought of. Yes, Sarah is correct. Hey, usually your gut feeling of an answer is always the correct answer. 9 times out of 10, when people change it, their first answer was the correct one. All right. So don't get that misunderstood. All right. Teresa says, I love this. Teresa, I love that you're here. You know what I'm saying? I appreciate that. Pitocin lowers blood pressure. Okay, here we go, y'all. Here's our answer in 3, 2, and the answer is B, fetal bradycardia. The client receiving Pitocin should be monitored for decelerations. It is essential to monitor patient fluids, such as their intake and output, while administering oxytocin, as well as the frequency of uterine contractions, patient's blood pressure, and heart rate of the unborn fetus. That is part of health promotions and maintenance. 9 to 15% on the NCLEX exam. Smaller section compared to the top 3, but still very important. Very important nonetheless. If you guys want to understand about the accelerations and decelerations, late decel, stuff like that, remember veal chop, right? Hey, real quick, ladies and gentlemen, I have an NCLEX course. I have 61 videos in there to include a new generation NCLEX review where I talk and I walk you through NCLEX style questions to include the case studies, all right? You guys can check that out. That link is in my bio. I feel like Dr. Umar. That link is in my bio, saying it 3 times. But you guys can check that out at thebootnurse.com/special. Also, the link is in my bio, so you guys go over there and check that out as well. Here we go. Question number 16. A client with diabetes visits the prenatal clinic at 28 weeks gestation. Which statement is true regarding insulin needed during pregnancy? All right, so now I have a patient that's 28 weeks pregnant who has gestational diabetes, right? Because, get it while you're pregnant. So what are we thinking the answer is? Is it insulin requirements moderate as the pregnancy progresses? A decreased need for insulin occurs during the second trimester. Elevation of the HCG decreases the need for insulin, or fetal development depends on adequate insulin regulation. What are we thinking? Shout out to everybody. Hey, if you're new here, we're doing NCLEX style questions or NCLEX questions. Got them off nurseslabs.com. These are free sets of questions. You guys can go over there and check those out for yourself. We are on the road to 20,000 likes. 20,000 likes. All right. Smash that like button. Make sure you guys share. Make sure you guys follow. Hey, don't be greedy. This is what I want. This is what TikTok needs to get other people here. You know what I'm saying? So don't be selfish. You know what I'm saying? Don't be selfish. Don't get all this knowledge and then just be like, nah, I'm gatekeeping. Because one thing we don't do around here, we don't gatekeep. All right. I'm going to give y'all 5 more seconds. Here we go. In 3, 2, and the answer is D. Fetal development depends on adequate insulin regulation. Fetal development depends on adequate nutrition and insulin regulation. Significant alterations in maternal metabolism during pregnancy ensures a continuous supply of nutrients to the fetus. Glucose is the primary energy source for the fetus. In early pregnancy, increases in maternal insulin sensitivity enables the storage of energy and nutrients. That is part of pharmacological and parenteral therapies. Second largest section on the NCLEX exam. Second largest. So I'm a type 1 diabetic, and this is good to know. Don, that's what I'm saying. This is good stuff. You know what I'm saying? Even if you're not a nurse or if you're not doing anything medical, this stuff is still very helpful. You know what I'm saying? I've been a nurse since 2015. Shout out to you, Gabs. Can I call you Gabs? Can I put an S at the end of that? So shout out to everybody that got that answer and got that question right. And if you don't know, that's okay. This is why you practice. Get out of your own head where you feel like you have to be perfect. Because I'm telling you right now, on NCLEX, you don't have to be perfect. You need to know what everyone else knows. You need to know what everyone else knows. All right. So here we go. Question 17. The client in the prenatal clinic is assessed to have a blood pressure of 180/96. The nurse should give priority to what? Providing a calm environment, obtaining a diet history, administering an analgesic, or assessing fetal heart tones. What are we thinking? All right. What are we thinking? Shout out to everybody that's rocking with me. Hey, like I said, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, right? Where are you at in your nursing journey? And if you're not a nurse, what you doing here? What you doing here rocking with us? Oh, by the way, if you don't like me yapping, no part of me cares. I hear people say, hey, bro, you yap too much. Hey, bro, shut up. So, that's the one thing about TikTok. You can either hang out and listen or you can not and go the fuck away. You choose. So shout out to, oh, first semester. Okay. Hey, so shout out to all my nurses that just started nursing school. I bet you got humbled real quick. Jordan, what you mean chill? Hey, I'm always chill. This is just me. This is how I do. First semester humbles you real good. All right, y'all, here we go. Here is our answer. California, okay. Graduated yesterday, waiting on the NCLEX, okay. LPN, okay. Love my nursing community. Hey, I love y'all. Hey, if you're a CNA, an MA, an LPN, anybody that's not an RN, like, I fucking love y'all. Lab, y'all are okay. You know what I'm saying? Because y'all be messing up my tubes and telling me shit be hemolyzed when you be lying. Pharmacy, I love y'all too. I love all y'all. I'm just saying, because we couldn't do shit. We could not do anything correctly if we didn't have y'all. And it's so important. So I appreciate all of y'all that are here. All right. And of course, the answer is A, provide a calm environment. A calm environment is needed to prevent seizure activity. Any stimulation can precipitate seizures. Establish measures to lessen likelihood of seizures, i.e. keep the room quiet and dimly lit, limit visitors, plan and coordinate care, and promote rest. Lessens environmental factors that may stimulate irritable cerebrum and cause of convulsive state. That is part of health promotions and maintenance, 9 to 15% on the NCLEX exam. I so needed this hate milestone. Hey, look, let me tell you something. I took HESI when I was in school too, and HESI, I honestly hated every bit of it. It was not helpful at all, let alone my school didn't even try to structure it to you. They're like, here you go, take it. Here, take it. I can't help you. What specialty do you work in now? I work in the OR, so I'm a OR nurse. I'm also a nationally certified surg tech, so I can actually scrub into surgical cases, but I haven't done that in a while, so I'm a scrub nurse. I work in the OR. Question number 18. A prima gravida, age 42, is 6 weeks pregnant. Based off the client's age, her infant is at risk for what? Down syndrome, respiratory distress syndrome, Turner's syndrome, or pathological jaundice. What are we thinking? What are we thinking? What school did I go to? Man, y'all be asking all the personal questions. Texas A&M. Hey, if you guys are new here, welcome. We're doing NCLEX questions, both for RNs and LPNs, by the way. RNs and LPNs. All right, I want to know who you are, where you're from, where you're at in your nursing journey. I'm a CST and a nurse too. Shout out to you, Cole. Shout out to you. I actually used to do something like this when I was active duty teaching in the Surg Tech program. I used to do this for my students as well. So if anybody's wondering how long I've been teaching for quite some time. RPN, shout out to you. How hard is the NCLEX? I'm scared. Hey, if you're scared, go to church. Here we go. I'm just playing. I'll tell you in a second. But the answer is A. The answer is A. Down syndrome. A client who is age 42 is at risk for fetal anomalies. I'm gonna say abnormalities, but anomalies such as Down syndrome and other chromosomal aberrations. The risk of chromosome abnormalities is higher. Babies born to older mothers have a higher risk of certain chromosome problems such as Down syndrome. Physiological adaptation. Third largest section on the NCLEX at 11 to 17%. Is the ATI test harder? Yes. ATI, HESI, any program that you take is going to be harder than the actual NCLEX. As somebody who's taken the NCLEX 3 times, trust and believe me when I tell you, the prep courses and stuff are a lot harder than the actual NCLEX is. I'm just saying the whole point is to give you hard stuff. That way you can train your mind. That way when you see it on NCLEX, you're going to be like, okay, that makes sense. They're not trying to trick me. Okay, ATI was so for me, and that's cool. It's for people, but you just don't know until you use it. All right, here we go. Question 19: A client with a missed abortion at 29 weeks gestation is admitted to the hospital. The client most likely will be treated with what? Magnesium sulfate, calcium gluconate. Is it Procedin E, or is it was it Paradel? What are we thinking? Shout out to all almost 800 of y'all in here listening and rocking with me. Hey, y'all got me to 23. Hey, shout out to y'all. Hey, you know what I'm saying? What team is the OR? What you mean? What do you mean? What team is the OR? From Zambia. Shout out to Zambia. All right. Hey, 30,000 likes. That's where we're headed. 30,000. Hey, make sure you guys share. Make sure you guys follow, especially you guys that are in school, or you guys and gals that are in school. Don't be greedy your whole life. You know what I'm saying? Give me them likes. You know what I'm saying? Give them to me. Here we go, y'all. Here we go. She will be treated with political backlash and no treatment. Joanna, what are you talking about? No idea. I'm lost. And the answer is C. It is a Procedin E. right? The client with a missed abortion will have induction of labor. Prostin E is a form of, was it a prostaglandin? Oh my God. I'm not even reading it. Y'all already know. It softens the cervix. Physiological adaptation, third largest section on the NCLEX. Labor and delivery was never my labor, delivery, and meds, bro. I'm just letting y'all know. What was the hardest class during nursing school? For me, I'm not even gonna lie to you, it was fundamentals or foundations, because I had already been working in the medical field for so long that I could not let go of bad habits. And so I almost failed fundamentals. I almost failed fundamentals because I couldn't get out of my own way. But but one that's neck and neck with that 100%, pharmacology. Pharm is a monster. It is a monster of a class. It is hard. Question number 20. A client with preeclampsia has been receiving an infusion containing magnesium sulfate for a blood pressure that is 160/80. Deep tendon reflexes are 1+, and urinary output for the past hour is 100. The nurse should what? So this is understanding what are the expected outcomes for somebody who has preeclampsia who is taking mag sulfate. This is how you apply your critical thinking in order for you to make a clinical judgment. Do I want to continue the infusion of mag sulfate while monitoring the client's blood pressure? Stop the infusion of mag sulfate and contact the physician. Slow the infusion and turn the client to her right side. Or administer calcium gluconate IV push and continue to monitor the blood pressure. What are we thinking? Shout out to everybody that's in here rocking with me. Like I said, I've been a nurse for 3.5 years. I worked in a burn ICU, a medical ICU, and I floated down to a neuro ICU. I floated to maybe med-surg, like maybe once or twice. So yeah, there is that. What are we thinking? I'm gonna give y'all 15 seconds. We got A's, we got B's, we got C's. Camille says D. Natasha says A. Okay. Got these questions off nurseslabs.com. You guys can go over there and check those out as well. Also, you guys can check out the link in my bio. I got a good amount of stuff that's over there. All right, y'all. Here we go. Here is our answer. Here, grab another bag is the answer. All right, here we go in 3, 2, and the answer is A. Continue the infusion of mag sulfate while monitoring the client's blood pressure. The client's blood pressure and urinary output are within normal limits. The only alteration from normal is the decreased deep tendon reflexes. The nurse should continue to monitor the blood pressure and check the mag level. The therapeutic level is 4.8 to 9.6. Magnesium levels must be monitored frequently by checking serum levels every 6 to 8 hours, or clinically by following patellar reflexes or urinary output. That is part of pharmacological and parenteral therapy. It says, I read into the question. Oh, okay. So you didn't do what we say do. You see how important it is that you read the rationales? Camille, this isn't to you. This is just a generalized statement. But this is how important it is that you have to read the rationales. You have to understand why you got the question right. But you really need to understand why you got the question wrong. That way you can apply that to the next time you see a question that may look familiar to this, okay? So, ladies and gentlemen, y'all don't know her, but this is Helen. Helen took coaching with me. She did it for 30 days back in October, and she did a testimony for me, and I put it up on YouTube. And there's the channel right there. You guys can go over there and check that out. This young lady is now a licensed practical nurse. So shout out to her and all the hard work that she put in. But yeah, you guys go over there, check that video out. Y'all go over there. Y'all can show her some love. Y'all can do whatever. But hey, if anybody is interested in coaching, y'all go over there, check out that video, see how it helped her. Check out the link in my bio. And if that's something that you're interested in, it fluctuates different. It fluctuates different for people. All right. So, depends on what you need. And hey, I got what you need. I'm like that dude like in the alley with a trench coat off Futurama saying like, hey, you want ears? You want a nose? Like, you want to be a different skin tone? I got you. No, I'm just playing. But seriously, shout out to her, all her hard work. Now she's out there, doing her thing as an LPN, and now she's in RN school. So shout out to her. Here we go. Question number 21. Which statement made by the nurse describes the inheritance pattern of autosomal recessive disorders? Is it an affected newborn has unaffected parents? An affected newborn has one affected parent. Affected parents have one in 4 chance of passing on the defective gene? Or is it affected parents have unaffected children who are carriers? What are we thinking? Shout out to y'all. Hey, we're on the road to 30,000 likes. Hey, we're almost there. Make sure you guys like, share, follow. Hey, I need 100 shares. We're at 100 shares. We've been on this thing for 45 minutes, y'all. 45 minutes. Y'all read too fast? What you mean? I read like hooked on phonics. What you mean? Like a speak and spell. And half the time they're already staring at the screen. You're probably just listening to me, so that's okay. I appreciate you. Army Wife, appreciate the share. Thank you. Appreciate the likes, the shares, and the follows. Appreciate everybody. Like I said, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Where are you in your nursing journey? And if you're not a nurse, cool. What you doing here hanging out? Yeah, my brain can't catch up that. Hey, that's okay. That's all right. All right, y'all. Here we go. Here we go. Here's our answer. Here is our answer. I'm multitasking, so I'm listening to you. All right, Camille, I'm tracking. Here we go in 3, 2. And the answer is C. Affected parents have 1 in 4 chance of passing on the defective gene. Autosomal recessive disorders can be passed from parents to the infant. If both parents pass the trait, the child will get 2 abnormal genes and the disease results. Parents can also pass the trait to the infant. So that is physiological adaptation, which is the 3rd largest section on the NCLEX exam. Boston, shout out to Boston, who is 5 years, step down ICU, now observation. Shout out to you, Jess, NYC OR nurse. Shout out to New York. Brooklyn, Marcy Projects. I don't know nothing about that. I'm sorry. I watch way too much Dave Chappelle. But physiological adaptation, 3rd largest section on the NCLEX exam. 3rd largest section on the NCLEX exam, 11 to 17%. So shout out to all y'all. Hey, sometimes these questions today just look really familiar at some point, okay? Ain't nothing new about it. Here from Rome, Georgia. I saw somebody say, is it Guyana? So shout out. We got people all around the world. So I appreciate everybody being here. Question 22. A pregnant client age 32 asked a nurse why her doctor has recommended a serum alpha fetoprotein. The nurse should explain that the doctor has recommended the test. Why? Because it is state law, because to detect cardiovascular defects, because of her age, or to detect neurological defects. What are we thinking? What are we thinking? Shout out to all you. Hey, you already know we're on the road to 40,000 likes. We're on the road to 40,000 likes. You know what I'm saying? 40,000. It says, I love this quiz. Shout out to you. Shout out to everybody that really appreciates this. Also, like I said, share it out to people. Marty in Miami. Shout out to you, Miss Marty. Maryland here. Okay, I see y'all. We got C, D. I'm going to give y'all 10 more seconds. 10 more seconds. CM, appreciate the follow. Thank you. User16, appreciate the follow. What are we thinking? Just now seeing this? That's okay. Hey, you can just now see it all you want, but if you follow me, you get to see it all the time, 3 times a week. You know what I'm saying? So here we go. Forensics. I'm studying for forensics psych, and this is awesome. Awesome. I'm glad. Here we go. In 3, 2, and the answer is D, to detect neurological defects. Alpha fetoprotein is a screening test done to detect neural tube defects such as spina bifida. Okay. It's a plasma protein produced by the embryonic yolk sac and the fetal liver. All right. That is also part of physiological adaptation, which, of course, is the 3rd largest section on the NCLEX at 11 to 17%. Hold on 1 second, y'all. Once again, somebody coming up in here trying to tell me to get they nudes. I'm just like, bro, ain't nothing that nobody can show me for free. I already passed my NCLEX, but it never stopped learning. That's what I'm talking about. Always coming here and learning. So I appreciate you. Here we go. Question number 23. A client with hypothyroidism asked the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that there is no need to take thyroid medication because the fetus thyroid produces thyroid stimulating hormone. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. Or is it fetal growth is arrested if thyroid medication is continued during pregnancy? What are we thinking? Somebody asked me, did you study UWorld or Archer? I've used both. I personally like the Archer better, but you'll have people that'll swear by UWorld, they'll swear by Kaplan, they'll swear by Hearst, they'll swear by whatever. But in reality, it's whatever works for you. I'll be completely honest. Yes, I took it during pregnancy. Oh, that's cheating because you already know then. No, I'm just kidding. Hey, use what you know. Use what you know. It says I'll be an OB and this is very helpful. Thank you. You're very welcome. Sorry, guys. I don't know what's happening here. All right, y'all. 10 more seconds. 10 more seconds. Shout out to all 400 plus of y'all. Make sure you guys keep smashing that like button. Make sure you guys share and make sure you guys follow. We're on the road to 40,000 likes. On the road to 40,000 likes. Hold on one second. Oh, Lord of mercy. I don't know what's happening. Hold on one second, y'all. Oh, never mind. It went away. All right, here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. During pregnancy, the thyroid gland triples in size. This makes it more difficult to regulate thyroid medication. During pregnancy, there are increased metabolic needs of the maternal body, resulting in changes in thyroid physiology. These changes in thyroid physiology reflect in altered thyroid function tests, part of pharmacological and parenteral therapies. Didn't know this? That's cool. Here's the thing. People are so caught up on like you have to know everything. Trust and believe me, you don't have to know everything. And if somebody's coming all up in your face saying like, how do you not know that? You could honestly just tell them to go fuck themselves. Because I've literally had people say, hey, how do you not know that? Bro, if you've never seen it or if you've never been exposed to it, hell, if you don't even remember it, that's okay. Like, that is okay. People need to get off their high horse and just realize that people learn differently. You know what I'm saying? So if you don't know, that's cool. Now you know, and now you can learn and you can improve upon it. And that's what that means. So shout out to everybody. All right, here we go. Question number 24. The nurse is responsible for performing a neonatal assessment on a full-term infant. At 1 minute, the nurse would expect to what? Is it an apical pulse at a 100 and an absence of tonus? Cyanosis of the feet and hands, or jaundice of the skin and sclera? What are we thinking? Shout out to everybody in here rocking with me. Hey, we're on the road to 40,000 likes. Hey, get carpal tunnel for me. Hey, make it happen right now. Carpal tunnel. Make sure you guys share, and of course, make sure you guys follow. Also, I got these questions off nurseslabs.com, both for RNs and LPNs, so you guys can go over there and check those out as well. And of course, I want to know who you are, where you are from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here, hanging out with us? By the way, y'all, I failed NCLEX 3 times. Once at 75 questions, once at 265 questions, and the other one at 106. And then I passed at 60. No one cares how many times you failed that exam. No one. No one cares. All right? So stop beating yourself up. All right? When you start working, no one's going to be like, oh my God, Susan, how many times did you fail the NCLEX? No one cares about that. No one does. All right? So get out of your own way. Here we go. Here's our answer in 3, 2. And the answer is C, cyanosis of the feet and hands. Cyanosis of the feet and hands is acrocyanosis, right? This is a normal finding 1 minute after birth. Acrocyanosis is bluish discoloration around the mouth and extremities with the remaining area pink. Yeah, so there it is. That's part of that. What is that a part of? What do we call that? What type of score? What type of score, right? So health promotions and maintenance, 9 to 15% on the NCLEX exam. All right. So what is it part of? There you go. APGAR, right? Do it in certain intervals, right? There you go. I got some smart people over here. What don't know about? So shout out to all y'all. I'm so nervous. You don't understand. No, trust and believe me. If you're talking about taking the NCLEX, we do understand. I do understand how nervous you are. Trust and believe me. Jill, yes, ma'am, you are correct. NCLEX shouldn't be stressful. NCLEX shouldn't be as stressful as school makes it. You guys got this. I agree. Who said that? Amy, I agree with you 100%. I don't know why they're like, you only want to get 75 questions or 85 questions. You don't want to take this test again. Okay, Miss So-and-so, who I haven't been bedside in 15 to 20 years. What do I do if I fail? You don't want to fail. That's not what I asked you. All right. Question 25. The client with sickle cell anemia is admitted to the labor and delivery unit during the first phase of labor. The nurse should anticipate the client needs for, is it oxygen, fluid restriction, blood transfusion, or cesarean section? Right? And that's the truth. It's just like, how do you tell me? How do you sit there and you're just like, you don't want to take this NCLEX again? And then guess what? You get up there and people have false hope and then they fail and then they just give up and don't ever want to do it again. You know, but that's not what I do. I don't ever tell you, hey, you know, you're going to pass. I tell you, hey, you have increased chances of passing. But it starts with you. It truly starts with you. And you need to dig deep down to see what your problem is in order for you to fix you, in order for you to conquer this exam. All right. That's what people need to realize within themselves. OK, so I'm just saying I'm here for y'all. I'm here for y'all. It says I've been a nurse for 5 years, but I always like to see if I can get them right. Brianna, that's OK. That's okay. Here we go, y'all. Here's our answer in 3, 2. Final answer is D. All right, Kayla. Well, final answer is A. So there's that for you, Kayla. I'm sorry, you're the last name I just saw on there. But the answer is A, supplemental oxygen. Sorry, guys. Sorry, y'all. Let me get this right. Clients with sickle cell crisis are treated with heat, hydration, oxygen, and pain relief. The supply of extra oxygen with oxygen therapy may be beneficial for some patients with sickle cell anemia. But the use of oxygen therapy in sickle cell anemia is controversial because high levels of oxygen are known to suppress the formation of new red blood cells. Oxygen therapy is therefore only recommended when oxygen levels drop below a critical threshold. That is part of health promotions and maintenance, 9 to 15% on the NCLEX exam. Hey, some of these are going to be controversial and you're not going to like them, but this is why it is important for you to go back and understand it. It says, I'm a med student. Who said that? I'm a med student taking a pediatrics this year. Here for a quick review. Is it Sienna? Ma'am, I'm glad that you're here. Sienna, I think I've seen you before. What is the best study material to study for NCLEX? It depends. There's a lot of good material that's out there. First thing I'll say is you can check out the 7-day NCLEX course, which is my course, which is linked in my bio, which is super duper helpful. But also I've been getting asked, hey, can you do stuff in a group setting where we can go over NCLEX style questions and go through a review together. And so, yeah, I'm actually creating that. I created a wait list. That link is also in my bio, but jump onto the wait list. And then whoever's on that wait list, those are going to be the people that are going to get an email saying like, hey, it's available. First 10 people to jump on it. You guys will jump on into the group with me. And we'll make some stuff happen. And you guys will be working with me for 30 days. So we're going to work 30 days straight where we meet once a week. You get all the calendar, you get the tracker, you get all the stuff that I have up in there in order for us to conquer NCLEX together. You know what I'm saying? Because you ain't doing it together. I mean, you ain't doing it by yourself. You do it with me. And you get the support of me, somebody who has been in your shoes, taking it the first time or taking it multiple times. All right. So shout out to all y'all. But make sure y'all check that out. That link is in my bio. Question 26. A client with diabetes has an order for an ultrasound. Right. So preparations for an ultrasound include increasing fluid intake, limiting ambulation, administering an enema or withholding food for 8 hours. What are we thinking? What are y'all thinking? Shout out to all 400 plus of y'all. Usually when I start going to those little clips, I lose like 100 people. They're just like, bro, I don't want to hear you. So shout out to you. Shout out to y'all. Hey, make sure, 40,000 likes. Hey, we're almost there. Almost there to 40,000 likes. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Also, I got these questions off nurseslabs.com. Free sets of questions. All right. 10 seconds. 10 seconds for y'all. Washington. Okay. What's up, Monet? How are you? You're in your senior year, Brianna. Okay. Shout out to y'all. Shout out to you. I'm new here. Take my NCLEX January 3rd. Shout out to you, Megan. Megan, I know you're going to crush that exam. All right, y'all. Here we go. NYC. Shout out to New York. Wait, what part? Oh, okay, you said New York City. I was about to say what part of New York. I got you. Some people be like, I'm from New York. Yeah. Are you though? All right, y'all. Here we go. And our answer is A, increased fluid intake. Before an ultrasound, the client should be taught to drink plenty of fluid and not void. Drink water and do not go to the toilet until after the scan. This may be needed before a scan of an unborn baby or the pelvic area. A full bladder is very important for the ultrasound exam. Empty the bladder 90 minutes before exam time, then consume 8 ounce glass of fluid, either be water, milk, coffee, about an hour before the exam. That is reduction of risk potential. It says, don't read into the question. The real thing is that you need to read the fucking question. That's what that means. RTFQ. That's what it means. Read the fucking question. By the way, if you don't like the F word, you're going to have a hard time being a nurse because the nurse's favorite word is the F word. I promise you. Hey, if y'all are fine, if y'all agree with me, just start smashing that like button. You already know y'all agree. RTFQ. You already know what the deal is. All right. So here we go. Whoa, hold up. Hopefully nobody saw the answer. But here's the question for question 27. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds in 1 year? Is it 14, 16, 18, or 24? RTFQ is crazy, right? It is crazy. You know what that tells me? You better do it. You better do it. All right, Jazz, appreciate the follow. Thank you. What are we thinking? Hey, this is both for RNs and LPNs, okay? The biggest difference between LPN and scope of practice, you need to know what you can and can't do, what you can and can't accept. right? You need to understand that you can only take stable patients, period. I don't care if you've been working and saw something different. According to NCLEX, which is a national exam, you take stable patients. All right, you take stable patients. But here we go. Here's our answer. Here's our answer in 3, 2, and the answer is 24 pounds, triple at 1 year, right? And by 1 year of age, the infant is expected to triple his birth weight. Between 6 months and 1 year, weight gain slows down a little. Most babies double their birth weight by 5 to 6 months of age and triple it by the time they hit 1 year. That is part of health promotions and maintenance, which is 9 to 15% on the NCLEX exam. Shout out to everybody that's dropping a follow. I appreciate you. Also, this is a smaller section on the NCLEX, right? But the big 3 largest sections, management of care, pharmacology, and physiological adaptation, all right? This one's still important, but those 3 alone make up almost half, 44 to 49%, all right? So it says, didn't learn this in peds. Well, hey, if you didn't learn it in peds, hey, you'll learn it. You should learn a lot of this stuff in OB, not just pediatrics, but OB, like mom and baby, right? This is how we need teachers to teach. Jenna, that'd be great, right? And this is how I love to teach. I've been teaching for it'll be 9 years next month. All right, here we go. Question number 28. A pregnant client with a history of alcohol addiction is scheduled for a non-stress test. The non-stress test does what? Determines the lung maturity of the fetus, measures the activity of the fetus, shows the effect of contractions on the fetal heart rate, or measures the neurological well-being of the fetus. What are we thinking? What are we thinking? Shout out to everybody. Hey, y'all got me to 40,000 likes. You already know the deal. You already know what's next. 50K, baby. 50K. Let's make it happen. By the way, if you guys miss any of these lives, they get put up on TikTok. I'm sorry, they get put up on YouTube. So if you miss a live, they get put up on YouTube. So you can sit here and listen to me for another, 2 hours and just listen to me run my mouth. And then, the occasional where I talk shit to people and I ban them. Whoops. There we go. There we go. All right, what are we thinking? Here we go. Here's our answer. In 3, 2, and the answer is B. Measure the activity of the fetus. A non-stress test is done to evaluate periodic movement of the fetus. A prenatal non-stress test, popularly known as NST, is a method used to test fetal well-being before the onset of labor. A prenatal non-stress test functions in overall antepartum surveillance with ultrasound as part or component of the biophysical profile. The presence of fetal movement and fetal heart rate acceleration is the most critical feature of the non-stress test. That is part of reduction of risk potential, right? And hey, here's a big thing to think about when you have parents or moms that are alcoholics and they drink and they're pregnant. Start thinking about those other defects that babies will start having, like cleft lip and, not having abdomens form all the way. They have evisceration of their bowels. I've seen babies that have had hearts not like their heart is just wide open, like chest cavity not closed because of moms who were smokers and moms that were drinkers. So those are things to pay attention to. After you pass the NCLEX, how long does it take for the license to post online? Jerry, that really just depends on your state. I know certain states that they'll pop up immediately, but then sometimes it'll take 2 days. Sometimes it takes up to a week. So it all just depends. In Texas, it takes up to 2 days. All right, here we go. Question number 29. Where can I study this? Nurseslabs.com. 29. A full-term male has hypospadias. Which statement describes this disease process? Right? Their urethral opening is absent. The urethral opening opens on the dorsal side of the penis. The penis is shorter than usual, or the urethral meatus opens on the underside of the penis. Basically. Hey, by the way, I'm a nurse. I didn't say I know how to pronounce all these words. And by the way, a lot of these words you're not even going to be saying when you become a nurse. So stop playing with yourself, all right? Because a lot of people would just be like, oh my God, how do you not know how to say that? I'm going to be like, oh my God, shut up. And I mean that in disrespectfully. So shout out to all y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. Free sets of questions. I want to know who you are, where you're from, and where you were at in your nursing journey. Also, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. It says you're a nurse and you can't say it. You're right, Manny. I'm a nurse and I can't say it. So, I mean, are you new here? It says, I'm not going to lie, I just guess. That's okay if you guess. It says D from the Philippines. Shout out to you. Florida here. What's up, Florida? I used to live in Florida. Shout out to Duval County. How often do you do these lives? I do them Monday, Wednesday, Friday, 5:30. I'm a nurse and I don't know how to say that. The hell? All right, here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is D. I say, hey, Kevin, I don't know if you remember me, but I found out I passed. Whoa, hold on. Echo says you passed NCLEX? Okay, shout out to you, Echo. Hey, I need everybody, while you guys are answering and reading that right now, I need for y'all to give Echo all the flowers in the world. Congratulations on conquering your NCLEX. All right, congratulations to you. Congratulations to you. Hey, if there's one piece of advice that you could give people about taking the NCLEX, what advice would that be? But congratulations. Congratulations to you. But yes, the urethral meatus opens on the underside of the penis. All right. So congratulations to y'all. Everybody. And that's for everybody that's taken their NCLEX and that's passed it within since the last time that we talked. All right. So congratulations to y'all. Here we go on to the next one. You're from Queens. OK. All right. Shout out to Queens. I've been to New York. I've been to Brooklyn. I've been to the Bronx, and I've been to Harlem. That's where my grandma stayed, you know. So here we go. Question number 30. A Gravida 3 Para 2 is admitted to the labor unit. Vaginal exam reveals that the client's cervix is 8 centimeters dilated with complete effacement. The priority nursing diagnosis at this time is what? Alteration in coping related to pain, potential to injury related to a precipitate delivery, alterations in elimination related to anesthesia, or potential for fluid volume deficit related to NPO status. What are we thinking? What are we thinking, ladies and gentlemen? Oh, I'm late. Yo, you are late. What's your opinion on nurses eating their young and ruining new nurses? I fucking hate any nurse that does that. And I hate them. And the thing about it is, like, I'm one of those people, I'm a no-nonsense kind of person. So if I see stuff like that, I check people that do that. I had a nurse try to do that to me, and I checked her right there. And I had to go talk to the manager the next morning. And I let the manager know. I was like, look, I don't know who she is, but I told her, I was like, hey, I'm not your husband and I'm not your son. So I know who you're talking to, but you're not fucking talking to me. And then instantly she's like, oh. So me and HR had a real nice conversation. So, hey, I don't play that nurses eat their young shit. I don't. Like, y'all, like all these older nurses that do shit like that must really forgot where they came from. They must really have forgotten where they came from. 10 seconds, y'all. And so I'm one of those people to remind them. How hard was the tease for you? I didn't take the tease. I took the Hesse. All right, y'all. Here we go. New learner. Is it Dylan? Shout out to you, Dylan. Here we go, y'all. Here's our answer. Steph, what is in? I don't know what that means. In 3, 2, they behave as if they were born as nurses. Exactly. Like, you forget that you were just born right out of the womb. Why do nurses treat other nurses so poorly? I don't know. I don't know exactly where that originated from, but I can tell you right now that it's one of those things that I never do. I never ever do, because I understand what it was like. And I would never want anybody to do that to me. And plus, I came into nursing already having an educational background. You know what I mean? So I know how to facilitate, and a lot of other nurses just don't want to do it, or, you know, who knows? It's a long, convoluted story. But the answer is A, alterations in coping related to pain. Transition is the time during labor, when the client loses concentration due to intense contractions. Assess nature and amount of vaginal show, cervical dilation, effacement, fetal station, and fetal descent. Cervical dilation should be approximately 1.2 centimeters per hour, and the nullipara, and 1.5 centimeters per hour of a multipara. Vaginal show increases with a fetal descent. Choice and timing of medication is affected by the degree of dilation and contractual pattern. That is part of health promotion and maintenance, right? 9 to 15% on the NCLEX exam. Smaller section, but still very important. There are 8 sections of the client needs, and this is the one that is very important that you need to know. All right. So shout out to everybody that got that question right. All right. How bad is the Hesse exit compared to the NCLEX? The Hesse exit is harder than the actual NCLEX. As somebody who took the exit Hesse, I can definitely tell you that's exactly how it was. All right, here we go. And ladies and gentlemen, that is it for the questions for tonight. We're right on time. It's usually about a little over an hour. A little over an hour where I go through these questions, all right? So I appreciate everybody that stopped by. I appreciate it. Yes, GG, girl, we got to go. I had the best mentor as well. Practice often differs. Exam facts, 100%. Nurse medics hating doctors. Nurses and medics hating doctors. It's not necessarily about hating doctors. The reality of it is like people, like they have an ego. Like there's something about the medical field or any profession that's like this. They have an ego problem. It's an ego issue. And then people to forget is like, you forget that you used to be a med student and you didn't know shit. You forget that you used to be a nursing student and a new grad and you didn't know shit, and people forget about that. And so rather than trying to, take people under your wing to show them, how to do things better and what you learned, they're just like, nah, fuck you. And that's not something that I rock with, like at all, period. So when people do that, I check them. I'm just like, hey, so you just talk like that to anybody? I'm just like, oh, okay. And people don't like me after that. You know what I'm saying? Doctors think nurses work for them. Like, I don't work for no doctor. I can tell you right there. Thank you, Kevin. I'm so much love from the North Country. And shout out to you, Miss Ma'am, Miss Army wife. Are you like in drum? I have to be like drum or something that's all the way up there. So, hey, I appreciate everybody participating. I had to ban a couple people. Most of them were bots, but then somebody coming in here telling me that I don't know how to spell something right, and no part of me fucking cares. So shout out to all y'all. Nurseslabs.com is where I got these questions from. Nurseslabs.com is where I got these questions from, so you guys can go over there and check that out. And right now, $97. $97 right now for the 7-day NCLEX course. You guys can go over there and check that out. Hey, I have a new generation NCLEX review, like a 4-hour long video of content to help you guys understand the new generation NCLEX to include case studies. So if you need tutoring, coaching, and all that other stuff, you can guys check those links out in my bio. My husband is retiring 24 years. Hey, shout out to him. I'm at 16. Who knows what I'm going to do after that? Who knows what I'm going to do after that, all right? But shout out to all y'all. So this is essentially where I do like a kind of like a Q&A type deal. It says, how often do you do these? Monday, Wednesday, Friday, 5:30. It says, what training is best for IV and BLS? I mean, you can never go wrong by going to the American Heart Association for BLS. Like that's where we all go through, right? So your LVN spring of 2024. It says, I'm an EMT CNA hoping to start nursing school in the fall. So Mark, don't hope, make it happen. Time zone, Central Standard Time, Texas time. That's the only time that matters. Yeah, I said it to you, Dylan. No, but yeah, Central Standard Time. My girl just made you hit. It says, my girl just made you hit 32,000 likes. She's an orange. Hey, shout out to your girl, Nick. Tell your girl I said thank you. I appreciate it. I shared your profile. I appreciate you. I appreciate you for sharing that. Hey, so I do these Monday, Wednesday, Friday. We go over nursing style questions for both RNs and LPNs. Like I told you, I've been a nurse for 3.5 years. I've worked in a burn ICU, a medical and a neuro ICU. And as well as I work in PACU and worked in the operating room. So I have a little bit of experience. I've been in the Navy for 16 years, mostly as a hospital corpsman the whole time, but I specialized as a surgical tech. Then I became an instructor, and I've been an instructor for the last 8 years, teaching. And I've done some other stuff too. So, but yeah, this is what I like doing. This is why I'm here. Should I include alien abduction in my medical history? You can if you want. Thank you so much. Started nurse school in January. Which one was your favorite? Ryan, what do you mean? Like which area was my favorite? I honestly like the PACU. How is nursing in ICU? It depends on, honestly, it really does depend on the ICU, but it's very fast paced. And if you want to get fast paced, cool. What's the difference between RN and LPN? Scope of practice. I love the OR. I shadowed a few times there. I had a bunch of students that came in that were nursing students that came into the OR who literally was just like, oh, I want to go ER. They hung out with me and they were like, yo, I think I'm going to switch. I think I want to go OR. And it's all about whoever precepts you. It's all about the person to give you a good overview about what you're trying to do. What days do you do your lives again? Monday, Wednesday, Friday. Hey, at any point in time, if you don't know, just go check my bio. It's written out right there as well. I started nursing school in January, or I start RN in January. Wish me luck. I don't need to wish you luck because you're going to do all right. Time management. You better get that down, Queen Bee, real quick, because first semester nursing school is going to humble that ass. Trust and believe me. Starting medic class next month, reclassing to combat medics soon in the Army. So you're going to go be a whiskey? Okay. I actually was stationed down at the schoolhouse where the whiskeys are. I taught surgical technology, so it was the 68 Deltas, not the whiskeys. So, okay, I already answered that. 21 years as an LPN, over it. Hey, Tippy Cole, you already know as a nurse. Yes, because you are a nurse. And don't let fucking people play with you and tell you that you're not a nurse. You go look for a remote job somewhere. Oh my God, thank you. You pronounce it right. Ryan? Yeah, Ryan, I got you. I can pronounce your name right, but I can't pronounce a medical word because who cares? Who cares? As long as you understand and you know what it is, right? What's your experience in the OR? I've worked in the OR since 2010 as a surg tech and then now as a nurse. So Every OR is relatively the same. It's just, how things flow and the nuances. So let's start. Okay, you already said that. You stand a lot in the OR. It depends. It really just depends on what's going on, and it depends on the case. How's the PACU? I loved it. You got people. You got them that came in from OR or from a procedure room. They hung out for about an hour. Then you took them up to the floor, and then that is like you had them for a max of an hour. And then every so often you get somebody who has breathing problems or you have a code, all that stuff. So I like PACU. A lot of people will be like, oh, brand new nurses shouldn't go to the PACU. Hey, shut up. Shut the hell up. Like, go. Hey, listen to me. Y'all go where you want to go. Go where you want to go. All right. Go where you want to go. Thank you so much for the love. You're welcome. I finished my LPN in 2 weeks and I want to go for my RN. How do you feel about an I did an accelerated BSN program and it was fine. How was your experience at the OR? Oh, the OR is fine. The OR is fine. It's fast paced too. Because you'll experience still some shitty nurses, and then you'll experience some even more shitty surgeons. But you got to have thick skin. But at no point in time will you let anybody berate you or disrespect you, and a lot of people forget that. So you have to check people too. And the one thing I'm going to tell you as brand new nurses that you guys are going to find that time where you're going to have to build your confidence, or people will walk all over you. Do not let motherfuckers walk all over you. Trust and believe me when I tell you that. I just waited for the code to schedule my NCLEX graduate on 2 weeks ago. Okay, so you're waiting on the authorization to test, or you? Yeah, Jessica. I take my T's in March. Oh, you're gonna wreck that. You're gonna do well. Switch to social work, finishing my master's. Shout out to you. Is it a good idea to become a CNA right out of high school? Yes. If you want to go nursing, Addison. If you want to go nursing, what better spot to be in? If you're trying to understand what nurses go through. It says, I'm a surge tech. What you had to do to get into nursing? So just because you're a surge tech doesn't mean that you're exempt from doing any of the prerequisites. So I had to do everything else. I had to do everything that everybody had to do. I had to do all the prereqs, and then I had to apply. I had to do the entrance exam, all that stuff. So I thought the PACU was boring. Depends on who you are. Some people like boring. Hey, if you like exciting and you like for shit to change on a dime, go to PACU, go to ER, go to ICU. But if you want something that is like very routine, you can do that. I like the PACU. So, but then again, me going to where I want to go is not about pleasing nobody. It's about pleasing me. So, and that's no shot at you. That's just, I'm keeping it real. Tips on learning how to do IVs. Practice. And having a good preceptor to show you how to do it the correct way. Any tips on newly nurses going to work in the hospital? Be a sponge. Is it Chriselle? Chriselle, RN, be a sponge and ask tons of questions, and do not let these people fucking bully you, because you're going to go your first 6 months to a year, you're going to be in imposter syndrome. You're going to feel like you don't belong there. You're going to feel like, why am I here? So on and so forth. I shouldn't have became a nurse. That is part of the process of becoming a nurse. I promise you. I went through it, and every other nurse, and I don't care who the fuck they are, they're lying to you if they didn't go through that. Trust and believe me. All right. So you got to be a sponge. And then you gotta be your biggest advocate. I work in med surg as a CNA. How long does it usually take approximately to prepare for the NCLEX? Ava, it depends. It could take, if you're coming right out of school, you should already be studying before you graduate. So you could take 2 weeks to a month. If you've been out of school for a while, could take 30 days, could take 90 days. But if you're doing it consistently, I always say study for no less than 30 days, but no more than 90 days. If you're studying past 90 days, what are you really doing? Do you like the OR PACU better? I like the PACU. I'm done with school. I just have to take the NCLEX. I'm at Chamberlain in St. Louis. Love watching these preps. Shanna, I appreciate you being here. You're welcome. Be assertive. Yes, Carla, you got to be assertive. I'm in an accelerated BSN program, 7 months left. It's hard, but it's worth it. Facts. I did one that was 18 months. Hell, they have one at Texas Tech that's like 12 months. And I'm like, bro, that is crazy. I have an unrelated bachelor's degree and thinking about LPN instead of BSN. If you have an unrelated bachelor's degree, why don't you just go to a direct entry master's degree program instead of going LPN? Any advice for my LVN journey? Is it Lee Villa? I would literally tell you is, you're going to go through the same thing that everybody else is going to go through, but don't be afraid about changing things. AKA, if let's say you go work at a long-term care facility and you're just like, hey, bro, I've been here for 6 months and I'm done. Go away. Hey, listen, when you guys have a license, either as an RN or an LPN, you are the CEO, Chief Executive Officer of that piece of paper. So you can literally go anywhere where they're hiring. Like you can go pharmaceutical company, you can go freaking medical devices company, you can go work for insurance companies, you can go do aesthetics. Like there's so many other things that you guys can do. How did you know you wanted to be a nurse? When I said it out loud, that's how I knew. Just graduated on the 14th. How long do you recommend studying for the NCLEX? For you, well, not for you. I would say anywhere between 30 to 90 days. I just said that, so. Ivy practice tips, drop. Okay, so you're giving, okay, Mark's giving you some knowledge. Any advice in exploring HHA or CNA before becoming an RN, or it's not needed? You don't need to be any of those before you become an RN. I know a girl who was a straight photographer, did not know anything about nursing, and then became a nurse, right? So you don't need to do that. However, you could work as a CNA so you could be familiar. And another thing too, let's just say you work as a CNA in an area that you love. You know, you can build the networking there. And then once you become a nurse, you can turn right around and work there as a nurse. Okay. Mallory. I know that was initials, Mallory. It says, hey, Kev, I just finished not doing NCLEX yet, but you're still questions help. Oh, awesome. Mallory, I know that they're helpful for you. You can even be private. We're talking about even be private. I have a bachelor's in psychology and an associate's right now. What is good advice to get my MSN? Just go. You have a bachelor's in psychology. Just go to a direct MSN program and get a master's degree in nursing. It could be clinical leadership. It could be whatever one that they offer. Don't need it, but it's very helpful. Tracking. What was the hardest skill in your nursing program you had to work on more than others? Honestly, I didn't have a problem. Like I already knew how to do, like they have the skills where you do medical administration, IVs, Foleys and all that. I was already an expert at that. I've done so many Foleys. I could do Foleys blindfolded. Wouldn't recommend, but I could do Foleys blindfolded. And I would definitely say my biggest issue was turning off corpsman. And Mark, I would say the same for you. It's like, because once you're a whiskey, you'll understand this, is turning that off and then turning on nurse. Because the scope of practice and the hows and the whys are different from corpsman than they are for nurse. That was the hardest thing for me. Thoughts on being pre-med to become a doctor, but also majoring in nursing. I actually have a guy that's in my reserve unit who's doing that. He's going into nursing program, but he's taking pre-med classes in case he wants to go, in case he wants to become a doctor. There's nothing wrong with that. If you have the mental capacity to do it, and if that's what you want to do, for sure, do it. Being a CNA being a CNA first does help produce a more compassionate nurse. Kinda. Army wife, kinda. That just depends on who you're talking to. We had to do the CNA course to get into a nursing program, and I'm so glad they made us. Oh, okay, I didn't know that. That's cool. It says it really made me appreciate the CNA. It makes you appreciate CNAs for sure, because now you literally are starting at the bottom when it comes to the medical care, because you're doing all these things. And then you become a nurse and then an RN, and then you realize that you have to delegate them. You have to delegate them to give them tasks. You know what I'm saying? What school is good for credentialization? Wait, what do you mean? Like, are you looking for like schools that are accredited? This is for all of you. If any of you ever want to know if your school is accredited or if they're in the accreditation process, just go to your board of nursing. And your board of nursing will tell you every school in your state that is accredited. And if it's not accredited, you might not want to go there. I don't care. Like, I know in California, they're just like, yeah, go to our school for $150,000. And then next thing you know, poof, you're in your last semester and they're like, hey, the school's shutting down. So now all of your money is wasted. And most importantly, all your time is wasted. So think about that. But I think I caught up on all these. So shout out to everybody that was in here rocking with me. We got to 50,000 likes. I think we had a max of like 900 people up in here. Another little shameless plug. Anybody looking for an NCLEX course that you get for a lifetime, you guys can check that up. That link is in my bio. You get it for a lifetime. So, like if something happens to you, and you old and you're decrepit and you want to go away, or you pass away, you can give it to your descendants. You know what I'm saying? Ancestors be willing, right? So you guys can go over there and check that out. Anybody interested or need help with like HESI, ATI, TEAS, pre-nursing stuff, prereqs, nursing school. I do one-on-one calls. You guys can check that out. That link is also in my bio. And then also I do one-on-one mentoring and coaching, which is, it's like the private the private call, but it's a lot more in depth and it's a lot longer. So you guys can check that out as well. And that varies between people. So it all just depends on what you need, what you want, and your availability and all that other good jazz. So Nick says, any advice for someone right out of high school wanting to get into nursing? I would recommend, if they're in high school, to go that medical assistant or CNA route. That would be the very first thing I would say. That way they have the exposure of being around nurses, or have the exposure of being around a hospital, nurses, being around people that they are wanting to be like, at that level of profession. RNs, LPNs, other CNAs, doctors, surgeons, PAs, nurse practitioners, all that stuff. That would be my recommendation. I'm proud of you. You came a long way in just a couple short months, Kevin Q. Hey, Mallory's an OG. She's been here for quite some time. So shout out to you, Mallory. I appreciate your nice words. Carla says, thank you. You are welcome. So what other questions do you guys have? Of course, like I said, another little thing about me, I've been in the Navy for 16 years, and I'm on the downward slope. It's almost time for me to go, right? So, so I bring a lot of the military aspect when it comes to mindset, leadership, as well as, into the nursing, but especially to those that are trying to get into nursing school, and then are on their journey to becoming a nurse. The one thing I don't like is where people play with y'all. And by play with y'all, I mean emotionally fucking with y'all. And I don't like it because people try to do it to me. And I'm just like, wow, I thought the military was bad and this was worse. So my goal is to help you pass NCLEX, period. But my other goal is to mentor as many people as I can. And this is exactly why I do this. So I appreciate everybody wanting to be here for that. Army Wife says, thank you so much, Kevin, for taking the time to help all of us on our journey. Facts. I like doing it. If I didn't like doing it, I wouldn't do the lives. What advice would you give for an LPN student about to take the exit exam for ATI? You can honestly, any YouTube comprehensive exam for ATI is a good one. But then this is accumulation. Biggest one, like management of care, delegation, your roles and your responsibilities, pharmacology, right? Those are things that you need to know when it comes to your exit. And of course, you're going to be taking your exit soon. Keep coming here because some of these questions that I go over will probably be on your ATI. I'm just saying. What's been your favorite field to work in? So right now, honestly, it's education. It is the overall aspect of education. I had no idea that I could take an actual curriculum, put it up on the board, and then rewrite it and then put it in an order that's more conducive for people to understand. So even from lectures to the overall clinic or chronological outline, I enjoy doing that because I don't like it where people are all over the place. And then that's where I bring it back. So, and I also like marketing because that's what I'm doing now. But the nursing aspect, I love the education aspect. I really, really do. Is it Jay back? Jay Backus. Oh, appreciate your support. Thank you. Thank you for being so educational and heartwarming for us being facts. That's what I like doing. That's exactly why I do that. Right. And eventually I'm going to be not moving off of TikTok completely, but I'm going to be opening up a community for us, where I can give you guys all this stuff, give you guys all this stuff. You guys get it, on top of, NCLEX help, essentially whatever y'all want. But I'm a one-man army, so I got stuff going on. We got to make some stuff happen. Do LPNs do the same courses as RNs? They, for the most part, they do. But then there are other classes that RNs do that are not LPN specific because of your scope of practice. So it says ditto to that. Facts. I hate ATI with a passion. Mallory, trust and believe me, I do. I've never used it, but I use Tessie and I hate it. What topic should I focus on when preparing for the ATI? I could have swore I just said that. Julie, got you, Julie, got you. I'll be there throughout my journey. And that's what I'm saying. That's why I try to tell everybody, hey, follow, because sometimes I just be posting stuff. I be posting gems. I talk about my NCLEX course all the time. You know what I'm saying? I tell my nursing students, hey, get this review now because you get it forever. Ask anybody in here that's taking an NCLEX course right now. All of them are on a subscription base. So instead of all this content going to waste, at least for right now, hey, you get content forever. You get content forever. You know what I'm saying? So, and you get all the updates. So that's why you'd be so surprised on the gems that I start dropping on here, for people that need to know. I actually got one email today where it said something about once you become an advanced practice nurse, like a licensed a nurse practitioner, that's only state dependent. It's only state dependent. So if you want to go be a nurse practitioner somewhere else, you have to apply in their state. There is no nursing licensure compact for nurse practitioners yet. So anybody that wants to go that route, you got to realize that where you are, you have to jump through hoops unless you're going to try to go live somewhere else. And then you got to do theirs at their state level as well. So shout out to all y'all. I appreciate everybody being here. What other questions do you guys have? Today is Wednesday. I don't know, on Friday, maybe I might do some case studies. Maybe I might not, I'm in Nevada and it's one of the only states not in the compact. Yep, it sure is. Not in the nursing licensure compact for RNs and LPNs, but Nevada will be there. I think Nevada is actually under FBI investigation. Not a bad thing. But they're under the FBI investigation to make sure that everything lines up correctly. That way, if you go from one state to another, that the credentials are good, so on and so forth. Wow, good to know. End goal is DNP. Exactly. That's what I'm saying. It's like some people, they just don't know that. Like, did you guys know that with the Licensure Compact Act, or the Nursing Licensure Compact, right, is that you can travel to any job as an RN or an LPN, but if you're moving there, you have 60 days to do it, to enact it, or they can actually revoke you in your hospital, as in like you can't work until you get your license there for that state. Unless you're doing a travel contract, then that's different. So, like if you're trying to take up residence in a different state, you got 60 days from the time that you get there, even though, versus like how if you're trying to go to California, or if you're trying to go like to Connecticut or Vermont or something like that, or like Minnesota, Nevada, you have to go through their boards of nursing to get a separate nursing license through them. So I knew a nurse who literally had like 5 or 6 nursing licenses because she had been traveling for 10 years. She had like 5 or 6 different nursing licenses, like to include like Washington State. Well, when they were outside, but now they're inside the compact. But like Oregon, California, Washington State, Minnesota, I think Connecticut, Vermont, Nevada, so those are things that you guys just got to look out for. Would you know if Virginia is a compact for New York LPNs? We do want to go back to Virginia. So that's super easy. All you got to do is go to the NCSBN website and then type in the nursing compact or nursing licensure compact, and it will tell you. It'll actually be a big old map, and I think it'll be green, and the green ones will tell you if it's part of the compact or not. Or would I be able to practice in VA as a New York travel nurse? If VA is part of the Compact Act, you could travel like that. But if you're taking up residence there, nah, they're going to make you switch. But easy place you can find that is the NCSBN, National Council of State Boards of Nursing, .org. You can check that out. All right. So what else are we thinking? Hey, also, I got a freebie over there for you guys. You guys can go over there and check that out as well. Free download. I go over talking about, the real test taking tips that you need to know for the NCLEX, like trigger words, stuff like that. Talk about delegation, ADN, a good idea. Yeah, why not? Still an RN, right? Still an RN. What else are we thinking? Shout out to all 7 of you guys in here rocking with me. If you guys are just now joining, we did NCLEX questions earlier. Did NCLEX questions for about an hour and 10 minutes. That's usually about the average about where I do NCLEX questions. We start at 5:30 Central Standard Time, Monday, Wednesdays, and Fridays. I'm actually going to start incorporating new generation NCLEX questions because that's what I get asked. But every single time I do them, there's nobody here. Nobody wants, there's people here, like we'll say like a good 40 people. And those people, they got all that information. But man, oh man, for the people that were in here today, y'all be missing out. That's why I say come every time I'm here. You never know what you're going to get. Just wanted to make sure I wasn't missing out on anything no, you're not missing out on nothing. You're not missing out on nothing. And I don't know. And I'm not, it's Silver Moon. I'm not trying to, what's what I'm looking for? I'm not trying to say this in a rude way, but what makes you think that you would miss out on something by going to get your associate's degree as an RN? You could just not do either one of those and go be an LPN and you still wouldn't be missing out on anything. Remember, it all just depends on where people are in their life to what they can afford to do and what they want to do. Because all it is just a progression at this point. 2-year degree as an RN, 3-year degree or 4-year degree as an RN. I mean, the difference is the classes and from those two, you know. Now, different from LPN to RN, of course, is the scope of practice, right? Some places pay a little bit more for BSN, but it's usually negotiable. Look, you know how much more they pay at the hospital that I work at? Like $1. Not even. As a matter of fact, I don't even think there is. I don't even think there is a pay raise for having because I don't even know why. It's stupid. It's all about what you want. Silver Moon, the sky's the limit. Facts. I'm getting my AD and getting a job with the hospital, taking advantage of the tuition reimbursement. Facts. Take advantage of it. Take advantage of the tuition reimbursement and for the fact that you're going to be working there, because there could be a point in time where you're going through the school and you're just going to be like, not when you're working there, you're like, I don't even like this hospital. I don't like these people, and you're just going to leave. So you better just take advantage of it while it's still fresh in your head. Just go all the way through it. All right. But yeah, for the 75 people that are in here, I failed my NCLEX 3 times, y'all. 3. My man, Davey. Hey, Dave. Hey, we're going to have to jump on here one day, like you and I, and we're just going to have to just conversate with people, you know, answering these questions. Like, we'll collab and we'll just answer these questions together. I know we've been talking about it, and I know you've been talking about it. So we most definitely can make that happen for sure. We can make that happen for sure. So I'll have to reach out to you and be like, hey, when's a good time for you to do it? And then we can make some stuff happen. I want to work trauma. Cool. Then go work trauma. What's stopping you from working trauma? Miss Frazier. The Miss Frazier. My man, I appreciate you. Yeah, we'll make something work. But yeah. So yeah, hey, y'all, I failed NCLEX 3 times. And I'm going to tell you something right now. Nobody cares. No job cares. That person that you went to school with that said, oh my God, if you need help, I'll help you, blah, blah, blah. They don't care either. They don't care. I care because I want you to go out there to be successful, which is why I do this, which is why I have my NCLEX course, which is why I do coaching, which is why I do mentoring. This is why I do all these things. It's because I care, because I used to be in this position. I used to be in the same position as you. And the last thing I want is for anybody to feel how I felt. I mean, I know that's going to happen, but they have an outlet. Won't let me pass? What you mean won't let you pass? Who won't let you pass? It says, I think my brain works differently and won't let me pass the boards until it's rewired. Yeah. The first thing that you need to change is up here. And you are absolutely correct. Like it is a mindset. A lot of people don't believe that. They're like, nah, it's just a regular test. It's not just a regular test. And if you say it's just a regular test, you're an anomaly. It says there is no GPA or pass rate on your license, just your name and a number. Facts. And you want to know what else is crazy too? The fact that I've heard nursing instructors at school say that you can't get into the ICU if you have a low GPA. That is the biggest crock of shit that I've ever heard. And the only reason they do that is to scare you. And to, falsely motivate you into getting into, where you want to go. So when they start telling you crap like that, no. What steps can you give having to retake it? Like what happened or what helped you to pass it? It says far from regular, and the next gen is a godsend for real. It is. The next gen, like people don't realize is like the next gen, like they give you a case study that has all the answers in it. Like it has all the information that you could ever need. You just need to differentiate what goes where. That's it. And you need to understand, when things are out of range, what do you do? It's all there. And then the questions, they fluctuate. And you get partial credit. But to Queen Bee, to answer your question, there was a lot of things I had to do. Like, for one thing, I had to take accountability. Like, I had to stop blaming everybody else, aka like my school, for not preparing me correctly. I had to stop blaming everybody else for the fact that, I didn't know the right material, or I didn't know what material to buy. Like nobody was there to help me. So it's just like, okay, I need to figure out. So sometimes, and you have to realize when it comes to everything in life, you have to do trial and error. Think about it. Like you're a parent. If you're a parent, like when you have your first child, did you know what you were doing? Nope. By the time you get to child number 2 and 3, you're going to be like, all right, cool. I've been through this before. I know exactly how they're going to act. I know exactly what they're going to do, blah, blah, blah. That comes with time and it comes with practice. Some people just get it on the first time and some people don't. And for those people that don't, now you got to go back and now you got to go back to the drawing board, see what worked, see what didn't, and improve upon that. What helped you pass the 4th time? Oh, Steph, I just talked about that. How is the test scored? The test is computer adaptive, and it's score essentially the test is scored on a 0 to 100, and you need to be above a 50. You need to be above a 50. Okay, so but it's computer adaptive. Okay, and by me saying it's computer adaptive, it is along the lines of based off how you answer. If you answer correctly, it's going to give you a slightly harder question. If you answer it incorrectly, it's going to give you a slightly easier question. And then if you answer that one incorrectly, it's going to give you an easier question. The whole point is that you want to be above the passing line. So and by the way, when everybody starts the NCLEX, you guys are above the passing line. I bet you people didn't know that. But they ask you a question, a slightly normal question, then they give you a hard question, then they'll give you a harder one. And if you get that one wrong, you'll go down. And then they'll give you a one up, and then one down, and then one up, one, and so on and so forth. And that's how it goes. Okay, so that's how the test is scored. It's essentially scored of you have to be above a 50. All right. Can we be study partners through this? Are you talking about? What are you talking about? What are you talking about, Queen Bee? It says I just need you to live. I just need you to lie. What? I just need you to live with you. You just need to live with me 30 days and train, and you'll pay. Hey, look. So I do NCLEX coaching. Like I said, like I literally will sit with you for 30 days. Well, not for 30 days every day, but I will literally sit with you once a week for at least an hour. Depends on whatever we're talking about, but you get at least an hour to where we sit and we go through everything, like whatever you have questions on. That's what I'm saying. Like that, I posted a video today on my YouTube. Go check it out. It's at the Boot Nurse on YouTube. And I just posted a video on there of a young lady named Helen that I coached in the month of October. In the month of October, and she took her NCLEX at the beginning of November, and she passed on her first time. And she was coachable, and she made some stuff happen. So I posted, I made the video and put it up, and of all the things that, not all the things, but little snippets of how the whole process went for her and I. And then I even posted at the end when we checked her NCLEX score together. And she really appreciated that, and she really loved it. And like I said, I do that for anybody. But if anybody's interested in talking with me in regards to anything they have going on nursing, just check those links out inside of my bio, specifically the one that says NCLEX coaching. And we get stuff working. Can we be study partners through this? Look, I help people through whatever. I am wanting to become a nurse. I have a state exam December 23rd for a certified nursing assistant. Cool. Tiana, knock that state exam out, and you can put in that work. Army nurse, it says, do you have to take the NCLEX for a state that you're transferring into? No, the NCLEX is a national exam. The NCLEX is a national exam. Stephanie, what did she use? What do you mean? What did she use? What did you teach her? Oh, what did I teach her? So the first thing is, so she used Archer's NCLEX questions. But she used my program for the content. She actually used both Archer and my program for content. And it worked out well for her. But like we went through a whole bunch of stuff. Very first session that we were on, I think, was like 2.5 hours. And we were going through like what is expected of her and then what is expected from me as her instructor or as her mentor and her coach. And she followed everything to the T. Everything to the T. So the thing about it is just like you have to be coachable. Like I had so many people that I tried to coach and they tried to tell me, and I was like, this isn't going to work out, so we're not going to make this work. So I taught her how to break down NCLEX style questions. That was a big thing. And then of course her understanding content. So we went to content that she didn't understand, easier ways that she can understand the content and how to apply them to questions as well. So I turn my notifications on when you're live. Oh, I appreciate you. Hey, I'm just saying. You need me? Hey, I'm here. But I'm going to start doing stuff off of TikTok. Like I'm actually about to do essentially like what I like to call a tour of duty. And that's a very military-esque. I think Army nurse will really I think you'll really appreciate the fact that I said that. But I'm going to do a tour of duty, but I'm going to do them like per section, right? So I think the very first video that I'm going to do is I'm going to talk about the NCLEX test plan. And that's going to be on it's going to be like a webinar base. It's going to be off of TikTok. And then I'm going to really, really mosey my way into, NCLEX retesters, right? I have a video that I have inside of my course right now called NCLEX Retakers for people that failed the NCLEX, because that was me. That's one of those videos I held near and dear to my heart. So Steph, you're welcome. Queen Bee says your heart seems like you'll stand by anyone wanting to. I'll stand by anyone who wants to further not just their nursing career, but their overall potential as a person. It's not, nursing is just the beginning, but you take the thought process of nursing, and that's the catalyst for everything else on how you move. How many hours a day did you coach her, and for how long? So she got 30 days. And we met once a week, and it all fluctuated. Sometimes it was an hour and a half. Sometimes it was 2.5 hours. Sometimes it was an hour 15, just whatever she wanted. She had my phone number, so she could text or call me whenever she needed. As well as I was able to look at her trackers and tell her what she needed to do and adjust upon there. And if she needed to have something that was emergent in between there, we would schedule something. So, but she at least got to talk to me once a week. And I have a schedule that's already laid out. And with that schedule, you can kind of schedule yourself. So, but most of the work came from her. As a matter of fact, all the work came from her. I'm your new stalker. Ma'am, you're coachable. Ma'am, if you're coachable and you want me to work with you, you already know the deal. I already told you. But Diamond, hopefully that answered your question. But Army Nurse, I knew that you would get that. Where do I sign up? Check it out. It's up here. Somewhere up here in this little thing where you can find it up there. Tiana says, do I have to do prerequisites for nursing before I get in the nurse? Yes, you do. Every nursing school. No, I take that back. It depends on how the nursing program is structured. There are nursing programs that you can apply for, and the prerequisites are already a part of their program. But so you'll sign in, you'll get into a 4-year nursing program, but your first year or 2 years are your prerequisite classes where you do English and stats and algebra and A&P 1 and 2 and nutrition and micro and chemistry and stuff like that. Or the cheaper route, which is you can go to a community college, right? Knock out all those prerequisites honestly faster and way cheaper, and then apply just to somebody's nursing program where you only do the nursing courses, So that's another way to think about it too. And micro, did I not say micro, Grace? Grace, when did you get here? I didn't even know you jumped in here, but shout out to Grace for jumping up in here. But yeah, so what other questions do you guys have? I think I'll hang out for about another 10 minutes. It says, I had to retake my prerequisites at a school because some schools say, yeah. So, and that's actually the school or the state. But yeah, depending on those science classes, the science classes will expire after 5 to 10 years. It all just depends on the schools, and it depends on the state that school is in for sure. So that's why I said do your prerequisites, and then once your prerequisites are done, jump right into it. Why do you look like the same person but with a different name? It says, what is your favorite area of nursing throughout all of nursing? Education. It's education. ICU was cool, but I loved the knowledge that the ICU provides. However, I didn't like the lack of knowledge and training that my ICU provided. But it's definitely nurse education for sure. It's weird. It's not even the fact that it's my favorite. It's not, now I'm overly obsessed with it. Where I'm oh, I got to learn this. I've been in here for a while, just quiet. Oh, okay, Grace, I got you. It says, click the link, but can't find your Addy. Just kidding. Doesn't see where it says to sign up. What you mean? It says, okay, I would need a tutor. Is the test hard? What are you talking about? Is what test hard? Tiana, are you talking about the NCLEX itself? Is that what you're talking about? I need to know what you mean. Hold on 1 second, because every time I get on a live, somebody says that my link inside of my bio doesn't work, but I'm literally looking at it right now, and I click on it and it works. So, Mrs. Frazier, I'm not sure exactly what you're looking at. What's your favorite subject in nursing school? It was pathophysiology. So the 7-day NCLEX course, do you teach live on Zoom? No, those are the 7-day NCLEX course. It is an on-demand course, user 93. Let me look again. So yeah, Miss Frazier, when you go on there, it'll be 1, 2, 3, 4. It'll be number 5 of the links that's on there. It says NCLEX Coaching and Mentoring Opt-in. That's what it is. And then of course, once you opt into that and you it'll take you to the page and all that good stuff. Yeah, it'll take you to the page and all that good stuff. And then if you have any questions about it, just send me a DM, or you can email me, whatever. You can send me a DM if you have any questions about it. I tell that to anybody. You guys go to any of my links, and if you guys have any questions about it, just DM me. And then I'll be able to hopefully give you a little bit more clarification. For the prerequisites for nursing, no, you don't need a tutor. You don't need a tutor for that, Tiana. You don't need it. I really don't think you need a tutor. But I mean, if you want a tutor, I can tutor you. But your prerequisites are going to be different depending on the school that you go to. You're welcome, user 93. What's your opinion on working in the NICU versus med-surg? Doesn't matter. Like, do you want to go there? So my question is, like, do you want to go to NICU or do you want to go to med-surg? People have the misunderstanding that med-surg is a specialty. You know, like, it's harped on in school because everybody's just like, oh my God, you need to go. No, you don't need to go to med-surg. I don't care what any motherfucker will tell you. You don't need to go there. However, med-surg is a specialty. Right? If you want to go to NICU, go to NICU. It's a neonatal intensive care unit. So things are going to move a lot faster in the NICU than they will in med-surg. So you just have to be very aware of that. And then, like I said, in the end, it's all about what you want. It's all about what you want and where you want to go. So Tiana says, oh, okay. Yeah. Oh, yeah. No problem, Tiana. I get it. Like you seem like you're super, like really like wanting to be engaged and wanting to try to, find something good for yourself. This is for Tiana. But yeah, for prerequisites, like all you need to do is find out what school you want to go to or what schools you want to go to. Like give yourself a big array of schools, and then look at their nursing programs and then look at their prerequisites. And that's it. So like if you have 4 or 5 schools and they all require the same prerequisite, go to your local community college and then literally start checking them off. Which of your subscriptions that you coach one-on-one? So the private one-on-one call is like a one-time thing. Now the NCLEX coaching and mentoring, that is a package deal for a longer period. That's the one that's like for 30 days. But if you decided to do the private one-on-one, and the private one-on-one is more about like, prerequisites, ATITs, HESI, nursing school questions, whatever. That actually can turn into a longevity type of thing, but it all just depends on you. It all just depends on you on what you want. But yeah. So it's essentially if you're looking for the NCLEX aspect, it is definitely the coaching and the mentoring one. I want the 30 days. Oh, then it would be the NCLEX coaching and mentoring opt-in. That's the one that it would be. Found it. Thank you. See, that's what I'm saying. Hey, so Miss Frazier, are you on the computer? Number one, are you a computer? Number 2, you're on your phone. And and then after that, like, what are you seeing? What are you seeing like when you were just like, I can't find it? Because you're literally like the millionth person you're on your phone. So the phone should have took you directly to my link tree. Hopefully that's what it did. And because that's what I do. And I was like, take me like, and I know all the links work because I make sure I check them. I check them like once a week because I'm like, OCD to make sure that all that stuff works. Right. And so I had to literally click. Yeah, I said it's in my profile. You got to click on the profile. You got to get out and you got to come back in. I have no idea how to at least put it in here. So I'm trying to figure that out. TikTok, there's a lot going on, you know what I'm saying? But shout out to all 50 of y'all in here. What other questions do you have? I found schools for nursing, but I want to gain more experience working as a certified nurse. So, Tiana, one thing I will say is make sure when you say certified nurse, you say certified nurse assistant. All right. I know people are going to know what you mean, but just to help you with the verbiage, because people will really try to check you and be like, you're not a nurse. Dude, we get it. All right. That's for other people, but to alleviate some headache for yourself, just say certified nursing assistant or certified nurse assistant, CNA, whatever you want to say. Secondly, you can gain experience while you're working as a CNA while you are in school. So the one thing I'll tell you, because I don't know how old you are, but the one thing I'll tell you is the one thing that you don't want to waste is time. So if you can work as a CNA, I would recommend working as a CNA and taking at least like 1 or 2 classes at a time, and start with your easy classes. Think of, English 1 and 2, micro, chemistry. Well, chemistry was hard for me, but chemistry, nutrition, psychology, sociology, all of the college algebra, statistics, like A&P 1 and 2. I think I said those. So Like, figure out which ones those are, put them in the order of precedence of which ones are easier. And then before you know it, a year, 2 years is already going to go by. You would have already had that as experience as a CNA, and you would have already had all your prerequisites knocked out simultaneously while you're applying for these nursing schools. Okay, I understand what you were saying. I graduated 10 months ago with 4 CNA. Oh, I'm tracking. I got you. Obviously, I don't know who you are, so I kind of had to make a blanket statement, but I'm tracking. I got what you're saying. So what other questions do you guys have? What other questions do you guys have? Let's see. All right. Well, we're coming up on 7:30 right now. I guess nobody has any other questions. You guys already know the deal. We do these Monday, Wednesday, and Friday. So I worked as a medical assistant for 16 years, and once I got into the core of nursing school, I'm assuming there's more. Now I work as a CNA. Oh, okay. I got you. So are you, Diamond, are you trying to go to be a nurse? I'm assuming that's what you're still trying to do, is go into nursing school. Shout out to everybody that's just joining. We were, okay, I'm tracking. I got you, Diamond. Everybody that's just joining, we did nursing NCLEX style questions at 5:30 Central Standard Time. That's the time that we always do them, Monday, Wednesday, and Friday. Now we're essentially doing an Ask Me Anything. So you got, I'm a nurse. My name's Kevin. I've been a nurse for 3.5 years. And I've worked in ICUs, OR, and I worked in PACU. So any questions that you guys have, cool. I'll have no problem answering them. How to rewire my brain and establish critical thinking. First thing I would say would be environmental. Like, what are your environmental things that and everybody is different. Like, so what are the environmental factors that are really, preventing you from understanding what's going on? So passing NCLEX is like, a lot of people just be like, oh, that test is easy. All you do is study. Yeah, but for a lot of people, we have no idea what's going on at their home life. We have no idea. I have no idea what your thought process is. Do you understand NCLEX style questions? Do you understand content? Do you not understand both? So it all really just depends. But first thing I would say is your environmental, surroundings and your thought process. Rewire. I'm going into my 4th semester now. Okay, shout out to you, and practice. But, a lot of people are just like, how do I practice? Like, how do I practice when I don't know what to practice? And that's true. And that's where I come in. So, but, like I said, I'm not everybody. Here's one thing too, I'll tell people, it's like, I'm not everybody's cup of tea. I've literally had people come in here and they were just like, and because people are always rude and they think about themselves. You don't need this. All you need is the book. Hey, Chad, maybe you just needed the fucking book. You know what I mean? So don't be that person to come up in here and say, what you feel or think other people need. You know what I'm saying? That's just like somebody just trying to force their beliefs on you, saying that that's how you have to be. It really is on an individual basis. All right. Definitely my surroundings and study techniques. I can relate to you though. I'm better hands-on. That's everybody. Most people are better hands-on, but your NCLEX is not a hands-on exam. It's very much, read, click on to the next one. I found that I can't study at home. I find things distract me and take my attention away. There it is. So Grace already knows. It's like she knows that's what it is. So I know, Grace, if you're going to be gone for a couple of hours, you're going to go somewhere where it's relatively quiet. Even though it's quiet, you want to recreate the testing center, which is another reason why, like, I'm fortunate enough to have an office. So I had an office, so I was able to recreate the testing center. I mean, no phone, no drinks, no snacks, no nothing. You know what I mean? So that's another way that you could do it as well. But definitely your surroundings, you can change that, and your study techniques. And then think about it, it's just like, what type of learner are you? Like, truly, like, what type of learner are you? Like, because a lot of people will just be like, well, I always just read the book and I take notes. And I was just like, yeah, but do you retain information? You're like, no. And I'm like, then that's not how you learn. It's a learning technique that may not be good for you. I can tell you right now, you put a book in front of me and tell me to write, within 5 to 10 minutes, I'm bored and then I'm sleepy and then I don't want to do it anymore. So then my studying becomes ineffective. So what we want is effective studying to where you can retain information. And there's like 4 or 5 different ones. Are you auditory, kinesthetic, visual? Are you a read write? Are you kinesthetic? There's like 5. There's like another 2 or 3 that are on there as well. So it all just depends on where you are. It really, really does. I love sitting in my SUV at the park and studying in my book at the library. Away there he is. And if that's a way that it works for you, that's cool. One way that I always tell people is that your NCLEX is not on paper. Your NCLEX is on the computer. So why not study that way? And I know I know people aren't fortunate enough to maybe have a laptop, but one thing I'll say to people is I was just like, look, you can find a way to take your kids to Disney World, but you can't find a way for you to get yourself a computer. You know what I mean? So those are things to think about as well. Hopefully that helps. If that helps, smash the like button. Y'all let me know. And, y'all, hey, I'm here for it. What other questions do you guys have? I said I was going to get off like at 7:30, but I'm still here. So what other questions do you guys have? It's the kids and I can't escape them. There it is. That's part of it. That's part of it. That's part of it. Kids are going to be kids are going to be kids. I have 2 of them, so I understand. Kids are going to be kids are going to be kids, and I understand that. But how are we going to adjust to them? They can't adjust to you. You have to adjust to them. Exactly. Of course they don't understand because they're kids, which is why I said you have to adjust to them. They don't adjust to you. So are you going to be able to study after they all go to bed? Most of the time I get all of my work done is like in the wee hours of the night because of my youngest, who is just he's 2 years old and crazy. What question bank do you like? There's a lot of question banks that are out there that I like. I like Kaplan's. I like Archer's. I think UWorld's test banks are okay. Hearst's are okay. There's a whole bunch of other ones that are out there that I'm not a fan of, but I'm not even going to give them I'm not going to give those people the satisfaction, and I'm not going to tell you to go over there and be like, hey, let me look at those questions, because if I don't like their questions, I'm just not going to talk about them. It's like, that's 100% true. I have 5 kids and I adjust to them. That's facts. You have to adjust to them. And so nothing relatively gets done in this house until night. And you study at night. Exactly. So now, to Mrs. Frazier, to you, ma'am, you got them badass kids. How you gonna adjust to them, right? UWorld was too complex for me. And that's what I'm saying. Which bank did I use? So when I finally passed NCLEX, it was Kaplan. I ended up buying Kaplan's like really big package for like $500 or some shit like that. But UWorld was too complex. But when I teach people in coaching, I give them my suggestion of what I think are good questions in a good Q bank, or I go off of what they already have. And if I'll flat out tell them, I'm like, hey, these questions are ass and they are terrible. You know what I mean? I homeschool in the morning. Oh, so you homeschool your kids. Man, shout out to you. Shout out to you for homeschooling them 5 children's. It says, yeah, I have to study when everyone is snoring, or I stay late at my job and study when everyone leaves. That's actually a good one. But the thing about it, here's the thing, is that when you study, you want to have some type of consistency. So not saying like if you already know that you're going to study at home when everybody's asleep, and you're going to study at work when everybody's gone, those are good. Those are 2 good places for you to study because you keep the consistency. Now, if you're telling me, hey, I study here, and then I study in the library, and then I study in the back of my car, then I study like at Starbucks, then I was like, okay, well, now you have confusion going on in your brain to where you can't make a decision on something simple on where to study, right? So if you put that into perspective as well, it's going to be very hard for you to pick a question, let alone the right, or not pick a question, but pick the right answer for a question. You know what I mean? So just 2 little ones. One is graduated. The other 2 are in high school. Okay, that's not so bad. So you got some babysitters at the house. So that's not so bad. I'm a visual learner, and I have to write it out a few times to retain it. Then I can do practice questions. Okay, so here's the thing. When you are studying content, that's cool. But when you are taking your exam, aka when you're doing a practice exam on the computer, you ain't doing that. You're not doing that. I'm one of those people, you practice like you play. You practice like you play. So, NCLEX is on the computer, get that ass in front of a computer. It says, when I'm acting, I'm like teaching, I retain. Oh, okay. So I see what you're saying. So so teaching others is a great way to retain it. Why do you say yikes, Diamond? Why do you say yikes? But seriously, like, you practice like you play. If there's one nugget that I could give y'all, is you practice like you play. Recreate the testing center, especially for my individuals who have already seen the testing center. Like you can even get as extreme as like getting a cardboard box and then putting a divider like in between your computers. That way it's just, because that's exactly what that's exactly what the testing center looks like. You know what I mean? So think about that. Think about that. But yeah, legitimately, I'm gonna hang out for another 5 minutes. I'm gonna get off here. I got some things I got to do. But of course, I appreciate everybody jumping on. I'm a visual learner I'm a visual and hands-on learner because I had to take the program for the CNA. Okay, so like I said, for NCLEX, hands-on's not a thing because the only thing your hand is going to be on is on the mouse, a pen, and a paper. Other than that, like you're not doing anything else. It's all. But when you're studying, most definitely, especially those ones like like how to put an IV, like 15, 30 degrees insert, bevel up and then lower down to 15 degrees, and push catheter, pull back on needle, so stuff like that. So is it because I need to work on my study style? Okay, I'm tracking. Yeah, so you do. I can tell you right now, as somebody who failed their NCLEX multiple times, 3 times, I would come home, I would then take a nap, said I was studying, I would take a nap for like an hour and a half, then I'd wake up and I'd have my laptop on my lap with the TV on mute, and then, or it would be all the way, muted, and, I had all these distractions. It was not a conducive learning environment. And so no wonder why I didn't do well. That's one reason. I didn't do well. I'm a visual learner, and that's good. So if you're a visual learner, you need to see how things work, or you need stuff facilitated for you. And that's cool because in my course, the 7-day NCLEX course, which is now $97, but you get it for a lifetime, I have PowerPoint presentations that are in there where I am essentially facilitating through the PowerPoint, dropping little nuggets here and there. Also, I have a review in there where I go through NCLEX style questions. So it says, when can I link with you for a content review? So if you're like, once again, is it Aljo? There's Aljo 365. Like I said, all that stuff is linked in my bio. All that, if you ever want to do like a review with me personally, I'm working on doing a group coaching or a group, a group NCLEX review, which I call the tour of duty review, which is where you work 30 days with me as a group though. And then, of course, I have the one-on-ones where we can do that one-on-one where you want it to be more personable. So I love learning through pictures and play on words, phrases that make the info stick. Oh, absolutely. Absolutely. And I'm one of those big ones too. Like I was teaching Helen how to remember metabolic alkalosis and metabolic acidosis, so on and so forth. And she was just like, oh my God, like I can't believe it's that easy. I was like, well, it's not about the fact that it's being easy. It's about the fact of you understanding what I'm talking about and being able to retain it and make it relatable to what you're seeing. And she's just like, oh, okay. And then when she took her exam, she said, I had one, but it wasn't straightforward about metabolic acidosis. It was more about, hey, your patient is displaying these signs and symptoms. What do we think is happening? And then boom, she was able to get that answer right. The belt trick. What's the belt trick? What are we talking about? Acronyms are my best friend. Hey, if acronyms work, they work for you. I love your teaching and your knowledge you give to all of us. Hey, look, this is what I do. And I thoroughly appreciate that. I enjoy your lives. Well, I enjoy you being here. I really do. I really, really do. What is the belt trick? Crystal, appreciate the follow. Thank you. I'm going to hang out here for another 3 minutes. So whatever questions you guys got, drop them in there. Hey, also, make sure you guys go follow me on Instagram. Also, follow me on YouTube. Everything is at The Boot Nurse. I had those links inside of my link tree, but they were kind of taking up so much space. So I just be like, hey, y'all go over there and y'all check those out. These lives will end up being over there. Eventually they'll end up going up. So I have like a good 2 or 3 weeks worth of stuff that's going to be populating on there, as well as the review. The testimony from Helen is also going to be on there. So she did a really good job. She was super nervous. You could tell she was super nervous. So I appreciate her for dropping that. But that she is now LPN out there, doing stuff, trying to get her stuff done with PED. So when will you be on next? It'll be Friday. Hopefully it'll be Friday. I have some family stuff that I have to do on Friday, but hopefully it'll be here on Friday. If not, I might pop on Saturday. But hey, make sure you're following me because when I post the story, that way you'll know if I'm going live or not, or just make sure you're paying attention to that. OB and MedSurg, here I come. Kari, you got it. He'll be on Friday. Hopefully I'll be on Friday. Army nurse, hopefully. Or Army wife, I'm sorry. But soon to be Army nurse. You're going to be, I'm assuming, Army wife nurse. You should just change your name to that once you become a nurse, right? So keep those notifications on, because when I come with the fury. I bring it. Like you, Thomas. Like, it's about to get hot. It's about to get hot up in here. And I'm actually pretty hot with this sweatshirt. I forgot how thick this thing was. You know what I'm saying? Monday, Wednesday, Fridays, I'll be here. Yes, ma'am. Yes, for sure. Yeah. Oh, yeah. You definitely will change. It'll say Army wife nurse or something like that. Let them know that you're an Army wife, and then also say that you're a nurse, because people are getting confused and be like, are you a nurse in the Army and you're also a wife? What? So it's funny because I dislike notifications. But for this, I actually pay mine to. Hey, look, and that's cool. I do the same thing. There's only a certain amount of people, like probably like 5 people that I do notifications for, because they bring something positive to you. It's not just some random person on here talking about being a flat earther. Look, I stumbled on one yesterday. No idea how I stayed there for 20 minutes. I was like, why am I here? How did I get here? Help. It was crazy. It was insane. So, but all right, ladies and gentlemen, it is now 7:45. I appreciate everybody being here. Last little plug for myself. If you guys need an NCLEX review that you can have forever, like until you pass away and then your descendants get it, ancestors be willing, you guys can check that out. The 7-day NCLEX course, that link is in my bio. As well, if you're looking for one-on-one, if you're looking for a private call, and if you're looking for a package deal where we can talk in regards to NCLEX, or even it's not just about NCLEX, it's mentorship all around. You guys can check that out, the NCLEX coaching and mentoring, as well as the private call. Got the victory guide over there. So all those links are in my bio. Check out YouTube and Instagram. Everything is at The Boot Nurse as well. Last thing, be kind to yourselves. You know what I'm saying? You only got one you. You know what I'm saying? And I want to say, like, if you're not getting into nursing school or failing an exam or failing the NCLEX, if that's the worst thing that can happen to you, I think that's okay. And I say that is because you could be somewhere else in the world where shit is on and popping. And as somebody who's been deployed, y'all know what I'm talking about. Y'all could be somewhere else in the world, not worried about that, but worried about surviving. You know what I mean? So remember, we got first world problems when people are dealing with some other craziness over there. It's all about perspective. That's all it is. Okay. So with that being said, y'all go check those things out. I hope everybody has a good rest of the week. And then I will see everybody hopefully on Friday, but make sure you guys are paying attention, and I will see you then. Bye.